Oh, no, I'm Nancy Wise. Apologies. Nancy Wise, Commissioner.
Pat Malone, Commissioner.
First right citizen member.
Cody Howell, citizen member.
And online is Chaz Jones.
Kaz Jones, citizen member.
Mariah De La Vega, BOC staff.
Laura Brightowski, board staff.
Kelly Buckland, budget analyst. Amanda McEwen, budget analyst.
Rick Baker, assistant county administrator.
April Holland, Health Department Director.
Rachel McEnany, county administrator.
Thank you all. For our first hearing is the health department. Hey, welcome back. Budget committee. Hopefully everybody had a nice hour break. We are now in the final stretch of the primary departments. We got 4 between now and 6 o'clock for session 2, and we'll be starting with the health department now, and then community health centers. And we'll finish up with community development department and NAPE for the rest of the day. So let's jump right in. April Holland is joining me as our director of the health department, and start off with a quick overview of the budget, and then she will jump into an overview. And,
I'm just gonna do a mic check because this mic seems to be going in and out.
Maybe we just share that one, I don't know.
Yeah,
That's fine.
the other two were charging.
Okay, so health department, again, we're kind of at the streak of the largest budgets, and you just heard from the public works department. And now we're moving, and health department had a $76.7 million budget, which is approximately 33% above the adopted level. And there's a couple things I want to point out, specifically a little bit different from this budget than we've seen the rest, and I'd like to make you aware of any anomalies or changes. But in personal services, one of the big drivers, you're seeing a 56.6% increase. Now that's much larger than what you have been seeing, anywhere between 20 and 25, maybe sometimes between 25 and 30. This is 2 pieces. There is obviously the driver of the things I've been talking to you over the last couple of days in relation to salary increases, as well as PERS and health care. But the other thing is the driver here is 27 newish positions that are in the current service level for our crisis center. So this is new positions that we are now beginning to bring online and hopes to become operationalized in July, August, something in that arena. So that's one of the big pieces to that. Vacancy factor is applied in the current service level for the health department at 2.6%, which again is very close. And with the vacancy rate sheet, you can kind of look at comparisons if you like from the previous finding, but is approximately close to what they were at 2 years ago. The proposed budget is equaling a 2.2% decrease. So again, we are looking at making reductions to be able to balance our general fund issue. This is composed again of the 2-year freezes on the management COLAs, as well as the reductions in retirement benefits. It also includes 2 FTE elimination and freeze. So again, I'll remind you, I'll use those two terms elimination freeze for other purposes. It's all in terms of no budget specifically for that, but what we have said is for any freezes, we reserve the right to come out and talk to the board of commissioners if revenues are found. So am I cutting in and out?
Yeah.
Sorry,
Is this one working?
it's better. We'll try it. So again, 2 FTE positions. We are also looking at application of additional vacancy factor to the health business office. Again, you'll find, and we'll talk a little bit about this later, the health business office is actually a shared department between health and CHC, but it's housed here in this particular budget. But both of them pay into it to be able to provide services. So we are looking for an increased vacancy factor from 2.6 to 3.7, primarily in relation to that particular budget area. So all in all, the proposed recommends about a $1.3 million the proposed budget also includes a $1.3 million policy package, and it establishes 3 FTE. 2 of those positions are existing limited duration. There's a new one, and then I should say, honestly, 3 actually are grant or limited duration positions. So again, April will talk a little bit about that in the policy package. All of those dollars, I should also mention, are dedicated funds. So that's not any general fund allocation we're making. They all have dedicated, the primary being like the Oregon Housing Community Services Fund to support the growth. The net effect of the budget adjustment and policy package is pretty minimal, so it pretty much washes each other out. I didn't even gather the percentage there because it's such a small amount, but it basically brings the proposed budget down from 33.7 to 33.1. So again, pretty much a net effect of 0. So categorically, in terms of where the expenses are, again, as to no surprise to you, personal services is the largest piece of the health department. And again, it is a shift, a larger increase for this finding and primarily driven by the crisis center in addition of those positions. In total, the CSL includes 208.15 FTE, of which we have a net increase of 2. So that would bring us to the 210.15 that April was to an organization. There's also an increase in transfers from the health fund into the CHC, and that is again, we'll talk about this a little bit. The behavioral health division of the health department is actually split between 2 different budgets. Part of it's in the community health center, part of it is in the health department. So, but all the budget resides in the health department. So some of those increases transfers is because of just increased costs, personal services. So that's the reason you're seeing the transfer increase there. The contingency increase that you're seeing is also related to behavioral health and some of the growing resources. So talk a little bit about the revenue sources, and this is a bit of an exciting moment. I know this is probably seem really geeky, but from a financial guy, it's exciting because it's something we've been wanting to do for some time. The general fund for Benton County has traditionally been a combination of what we think of as real general fund, property tax dollars, discretionary, but it's also always included health funds, which are a lot of grant dollars. And from a financial perspective, it's been very confusing sometimes to be able to isolate general fund because that is usually the gap filler. Those are the dollars that are most flexible. So this is the first time this biennium we are actually moving to the health fund. So there will be a separate health fund from the general fund, and the health fund for discretionary resources that the health fund needs, it will actually show as a transfer as opposed to being a blend. And again, from a financial standpoint, it gets kind of confusing when you're trying to look at flexible dollars and be able to evaluate the general fund. So I know this is something a lot of counties have had in place, but this is a good first step to being able to really have a little more financial transparency within the county's dollars. So that's why you see 70.6% of the health fund is dedicated. So again, these are all dollars that mostly come from the Oregon Health Authority, a variety of different types of grants and resources. We do have licensing fees as it relates to environmental health charges, Medicaid billing, and our charges for services that we see in this as well. So those are all dedicated specifically. And then you will see health and discretionary, and now that's the transfer. So now you have a good representation of how much general fund is being contributed and budgeted specifically to the health department going forward. And again, it gives us much more visibility and better management of our resources. They'll still have a small portion of their budget in the local option levy. As you all know, we call the local option levy and general fund. It's all general fund basically. But there will be still a small part that's there. We didn't completely clean that out. So we'll probably look at some adjustments to that later in the future. And then the Health Management Service Fund, I mentioned this earlier, this is kind of a mini internal service fund that's built into the Health Department and the CHC. It serves both departments. Both of them pay into that fund to be able to provide the services that support both departments. And then finally, you have a special grant fund of 7.2, and this is where the money, mostly the money from the Reagan Housing and Community Services, the newer money that we've been getting for shelters and things like that, and for the Coordinated Homeless Response Office. That's what the majority of those dollars are. So these are the functional areas that April will start to dive into. Again, it's divided into the administration. We have public health, behavioral health, and developmental diversity. Those are the three primaries. As mentioned here, we have the health business office, which again supports both, and we will talk about it here in this particular budget, but Lacey may touch on it as well when we get to the community health center. So with that, I think I will invite April to kind of jump into each of these sections and talk a little bit more specifically what they do and some of the budgetary impacts.
That's great. And if you'll literally hand the mic over. Appreciate it. Hi, Budget Committee members, commissioners and others joining us today. My name is April Holland, again, Health Department Director. Happy to present the proposed budget, at least follow up from Rick. I'm joined today in the audience are three division directors. If there are any specific subject matter operational questions, they're available. Thank you. To know one more time. Thank you. So with us today, we've got Damian Sands, Behavioral Health Division Director, Sarah Hartstein, Public Health Division Director, and Jasper Smith, our Developmental Diversity Director. So I'll just begin by providing an orientation to health services. Then we'll go into a little bit about what each division does and look at those budgets one by one. We'll look at some goals for our Healthy Communities Initiative, look at our policy option packages, and then finish up with a message on what we're looking at for the next biennium. So the chart that you see on the screen now, if you could go back to the rainbow chart there, I just want to look here for a moment. This chart is due for a revision, but it still does a fairly good job of encompass the relational and integrative work of the community health service centers and the health department. So the community health centers budget presentation, which will follow the health department, will be presented by my esteemed colleague Lacey Malell in the back of the room. It'll include many items listed here in this presentation, but maybe not discussed in as much detail. I just want to note that while our departments are separate, Lacey and I work very closely, and we both hold community health stewardship, community engagement, workforce wellness, and belonging as shared values. Here on the rainbow chart, you can see the population-centered services on the right side. You'll see and recognize a lot of traditional public health services on this side, from health policy to harm reduction, communicable diseases, environmental health. We really do have a lot of integration when it comes to those pieces that touch both public health and individual health. Our community mental health program, certainly with crisis and safety net services, is included among those. And then as we get more to the left side of the chart, you can see, with substance use disorders, specialty mental health programs, and then down to the really individual primary care home types of work that the community health centers does. In the middle there is all the things that sort of blue glue us together, the business services, the records, the accountability pieces, reporting and things like that. Slide, please. So jumping into the health department overview, I won't be reading all of these slides. You have a lot of information in front of you. And please let me know if you'd like to slow down or talk about any program or initiative in more detail. But the health department includes, as noted earlier, behavioral health, public health, DD or developmental diversity. It also includes our coordinated homeless response office, our health business services, which also includes some shared health services. We can talk a little more about that in a minute, as well as the health department administration. And here's an org chart outlining the various the way that we're divided in the budget. I'll note that the coordinated homeless response office, which is noted here to the right of the health department administration box, it remains nested in the public health budget. And that, you know, most of their funding is through special grants, and the coordinated homeless response office was considered a pilot and a fledgling opportunity at the beginning of the last biennium. As this work, as this fledgling office continues to evolve, this could be pulled out separately in the future because it is starting to have an outsized impact on the public health budget. The other thing of note here, and those of you present at the last presentation, last biennium, will recall that the behavioral health division budget, it holds a large number of FTE and higher this time around, as Rick noted, due to the expansion of crisis services. However, about 49 or 48.65 FTE are in the health department budget, and the remainder are within the CHC budget. So that's one of the areas where we have that crossover and integration, and so you'll see that in two places. And then I think the rest is pretty self-explanatory. We can go ahead and jump into each of the areas. So health department administration, we've really shrunk this area of work in terms of how we budget it. In directors past have had an office of the director with several shared positions that fell into this health department administration. What we've done is either relocate some of those back into public health or identify those as shared health services that are paid for by both departments. We do still have in this budget presentation 3.1 FTE. So there is, and we've also just really looked at some cost savings and have reduced that budget by about $57,000. And then our focus there is listed on the slide. Moving on to public health. Public health has a lot of programs. Public health does a great service to our community, as do all of our divisions. It's often a surprise to people when they think of public health, when they think about restaurant inspections or communicable disease investigations. And it is a very broad and encompassing charge to protect and promote and prevent disease and other ill health effects. You'll see in the slides ahead that there are several descriptions. We're happy to talk more about that. Again, just want to call out that the Coordinated Homeless Response Office, or the CRO, is listed within this budget, although it is a separate body of work. And the total CSL is almost 22 million. The net increase in FTE, and that increase in proposed budget is really largely attributed to grant funding, the special grants through the coordinated office. I want to be clear that in today's atmosphere, we aren't having large increases in our public health budget outside of these special funds. Sorry about that. So again, that $848,000 figure includes the special grant funds for housing programs. The net FTE proposed are all funded by grants and are outside of the general fund. We'll go into details about what those are. And the next couple of slides are for your own reading pleasure. Really encourage you to enjoy looking through the many areas of work of public health. Division that we'll look at is developmental diversity. The DDE program, as we call it, provides support in many ways. They wrap around people who have been identified as having intellectual and developmental disabilities. They seek to help them fulfill their lives to live their lives in the ways that a person wants, and in so many ways. They are amazing, and rely on some match funding for their budget, which is provided in the general fund. The way that we determine whether DD requires additional FTE is generally through caseloads, and then those caseloads reach and exceed the threshold, certain thresholds, and as they continue to have more and more people who need their valuable services, we typically have increased DD by a position or two every biennium. However, we were able to accomplish an FTE increase outside of the budget process this time, and they are going to look at a reduction of about $147,000. Okay, so behavioral health, they are another example where we had a lot of shift that happened midstream with the construction and operational planning for the crisis center. Those about 27 positions were approved and are outside of general fund. These are all dedicated funds. And there's a small increase in the CSL that is due to a technical adjustment. And in the next couple of slides, it will take us through some of the work that behavioral health does. I'll just kind of outline broadly as we move through. The adult outpatient services are more integrated with the community health centers, children and family services. They serve, they have the traditional outpatient family and children's services, as well as several specialty programs. And next slide. The ESA, Early Assessment Services, is really designed for youth and young adults who are experiencing the first episode of psychosis. And the ACT team, or the Assertive Community Treatment Services, are really focused on adults with severe and persistent mental illness. Our peers or people with lived experience, and that's shown to be a really effective and powerful way to reach folks and help them. We've got housing services and behavioral health, And of course, we've got a psychiatry team with 2 psychiatrists and 2 psychiatric nurses. And then there are substance use disorder treatment services, which provides treatment for individuals experiencing substance use and dependence. And then our crisis and forensic services, this is of course where the crisis stabilization services will be held. They'll be provided at the New Bedford County Crisis Center starting in July. And then another service to note is pre-commitment investigations for those who need a safe and secure level of care, among many others. So this slide has a lot of information. We fit a lot into this bucket where we've covered public health, behavioral health, developmental diversity, and now this is sort of the circles in the middle of the rainbow chart, these shared services. So health services and business administration includes our records and health information management, our billing and coding and credentialing pieces, our QI and data services, otherwise known as our SOS team, and then our shared health services. So there are some positions, as I noted here, like our onboarding folks and health communications team, which are paid for by both departments.
We're kind of getting a signal from the back that it might be your stopwatch that's creating that. The other thing I want to try is holding one of those mics, just.
Well, I wonder, so we raised the volume all the way, right, which I noticed we usually make them do that, so maybe if we try lowering the volume.
You know, I can drop it a little bit.
Okay, well, I've taken the smartwatch off, so
You're so smart, though.
thank you. Oh, gosh, I don't know. I should have known not to wear it. Thank you. I do think that may have actually been triggering the mic. It was also probably listening to everything I was saying and.
It's a public meeting anyways.
Okay, it's fine. So these shared services, really essential. Lacey and I both know that this level of integration and sharing is something that makes us all stronger, and every position that is within these 22.6 FTE are serving both departments, and therefore half of the county, if not more, in terms of its direct service provision. So next, we're going to go into our goals. This goal, I will acknowledge, is very wide-ranging, and it is intentionally somewhat vague. And the reason that it's here is because we are existing in a very uncertain landscape right now. We are following federal, state, and local changes and really uncertainties that we haven't seen in a long time. And I feel like I say that a lot in my role, but after having come through a pandemic, we're in a new state of anxiety and unknowns, I guess. So our first goal is to really pay attention, be proactive, and plan for the many scenarios that may exist. We really intend to focus on the services, that we're obligated to provide, and to do as much as possible to be mindful and innovative and center the community and its needs, and regardless of what comes. And so I don't know if all of you are following the ins and outs of the various executive orders and the injunctions and the stays and the TROs, and it's something that we have to keep on top of. And as we learn more about changes, we'll have plan, A through L in our pocket. So that's why we have this goal here, because we know this is an unusual, it's gonna be an unusual biennium. The second goal is part of us sort of moving from assessment to implementation with the health department's communications work. This biennium, the Public Health Division has engaged in communications assessment with the contractor and is finalizing a plan that will be put into work to really modernize and to ensure that the community has the information that that they need when they need it, and that they're able to access it. This next goal is a big goal. I tried to take one part of the goal and it didn't seem, and just use that. And then, so I had to put all the things in. Our coordinated homeless response office includes a program called the Flexible Housing Subsidy Pool. They have been awarded a grant to pilot another rapid rehousing program, and it's specifically for people with behavioral health needs. So really targeting, looking at and wrapping around our most vulnerable community members who are unhoused. So this goal is a multi-step goal. Rehousing at least 15 individuals or households. And by the way, in this last 10 months of operation, they've rehoused 51 households and about 110 individuals through this program, and with lots of community support. So they will be implementing this new pilot grant. We will continue to partner with the city of Corvallis to use some properties that the city of Corvallis has purchased. We will be the operator of services for those units. And then we'll continue with an initiative to further our landlord outreach and recruitment program. There's been a lot of efforts to bring property managers and landlords to the table, and the coordinated office has been successful with bringing 13 individual property management agencies into leases with folks who are on. And then our next goal here has to do with behavioral health, and behavioral health has been awarded a grant to renovate a portion of the space in the Barbara Ross building, which is just down the road here and currently houses our Children and Families program. This grant will establish a young adult hub to really focus on accessible services to young people in a welcoming space. This is going to focus in on ages 14 to 26, and it will be integrated with many of our existing youth services, as well as some new ones coming online. Okay, if you want to start with the impacts, I'm happy to check in.
Thanks, April. I'm just going to slide back just really quick so you make some connection to earlier presentation. When we are talking about financial services department, and I was showing you that flow chart, and there was the group that was off to the right. This business service in the right-hand corner, that's what that represents. I just want to tie with you that organizationally, for the leases budget, that is fit within the financial services department. Budgetarily, it sits here. But April, myself, and Lacey have been working together in partnership on how do we reimagine this area in terms of moving forward. And so, obviously, there's been some changes and transitions that have taken away from our efforts, but as we move into this next line, we still want to continue to work in partnership within this particular team because it's a great resource, but trying to figure out how to make those connections a little more and also officially make that move back into the shared services from the financial services department. So I just wanted to make that connection for you from the previous conversation. So I'll quickly just go over the summary of what I spoke of earlier, $1.67 million reduction to the health department budget. I'll highlight the numbers and then turn it back to April to talk a little bit about some of the impacts she's seen with these reductions. So first, again, the elimination of the $365,000. Again, this is a higher number than you've seen in other budgets. It's a bigger budget, obviously, and obviously it's really will have impacts in relation to, as Tracy talked earlier, in terms of routine workforce, recruiting workforce, and so those are obviously concerns, particularly in an area like health that is already hard to recruit and retain. So I think that's something we need to keep an eye on, as Tracy mentioned this morning. Elimination of the 1.0 FTE Health Equity Communication Manager, that is approximately $354,000. So that is a elimination of a position. And I'll just again, this is a vacant position currently. Actually, all the positions, with the exception of one that we talked about, is they're all vacant. We would increase the vacancy factor from 2.6 to 3.7. I think, we've talked with April and we believe that that is manageable. They were able to demonstrate that in the last budget. I think it'll be manageable for this budget as well. We would do a freeze of the 1.0 FTE communicable disease nurse. So again, the difference between freeze and elimination, they're all budget reductions, but in this particular case, again, with the unknowns of resources, it does at least reserve the right for April to come back and have a conversation if resources do present themselves. But again, all of those would have to go through the Board of Commissioners in terms of approval. So again, I just want to distinguish the terms on them. We also have a small amount of materials and service cost savings that from just overall belt tightening, and then finally there is some cost actually, I should say cost decrease or increase, excuse me, decrease from a general service department adjustment. So that's a savings component for April and the health department. So with that, I'll maybe send back to April. She talk a little bit about what she's seen as some of her impacts.
Sure, thank you, Rick. So potential impacts listed here are just that, their potential when we're looking at the elimination of ECI and reduced retirement benefits for management. There is a potential that there could be increased turnover in management positions, and there's potential for possible decline in morale. I haven't seen that as a huge issue at this time, though I have heard concerns. That the HECE manager, Health Equity Communications manager, that was eliminated, it does increase the span of control and the work for the Healthy Communities manager. However, we try to assuage that somewhat by having our one of our communications coordinator, putting them into a lead position, and then just ensuring that there is ongoing support, not only from the Healthy Communities manager, from the Public Health Division manager or director, and beyond. And then finally, freezing the communicable disease nurse position is it is a hard one for us because it can diminish the capacity of the CD team, our communicable disease team, to really respond effectively and in a timely manner to outbreaks and diseases. Unfortunately, CD is one of those places that is just not really well funded by state and federal dollars. And so there are some things that Sarah Harstein, our public health administrator, and others are working on to mitigate this freeze. And that will include, really widening the net to ensure that we do have some internal capacity to respond, training more people on quick response for communicable disease. But we can't really say that there would be no impact not having a communicable disease nurse on an additional on staff. You want to do the summary and then I'll go over each one?
I'll do whatever you want. So again, policy package wise, there was $1.3 million of recommended budget increase, but in total, the health department asked for 7 requests, that equal 1.85 million. But you will note that only 42,000 of that was general fund. So again, most of all these asks are with dedicated resources. The biggest, of course, being the, again, housing community services dollars that you will see one of the packages here. So based on Rachel and myself reviewing and going through this, we did recommend 4 packages. That brought the total to 1.346 million, 0 increase in the general fund piece. And again, that's related to a vehicle piece that April talked about in terms of the policy package itself. These recommended packages, ultimately, when you put these adds versus the decreases and adjustments that April just spoke to, brings it to a overall net decrease of about 324. So I said earlier, minimal, you can see a 0.04% decrease to the health department CSL, and overall that puts us about 31.1% higher than the proposed budget. And again, I sound like a broken record, but I will bring it up. That part of the larger increase that you're seeing in the health department is related to the crisis center and the new positions.
The summary. So our first hop is for a bilingual communications coordinator. We've had Spanish bilingual communications professional on staff as a limited duration position. That really has revolutionized communications. It's allowed us to really have one-to-one English-Spanish communication for all external communications. It's kind of an added bonus that the individual in this position is also a graphic designer and pretty whiz-bang smart in a lot of ways, communications. But the justification for making this permanent is that this really brings the public health division to public health modernization standards, and it's paid for through public health modernization dollars. And this one was recommended for funding. So this next policy option package, it's got a bit of a caveat to it. We've heard this before. The federal funding was in question. This was part of a program element through COVID that was slated to continue through June 2026. This position is not currently filled. However, because the funding is still in the air and we don't know what the next year will look like, we would like to hold this recommendation and continue to watch whether we're able to move forward with this funding. The next policy package request that we have, number 3, midway through the biennium, we undertook an examination and assessment of the 2 permits clerks. They do a position share 0.6 FTE with 2 individuals, and found that they were doing work at the next classification level. So they've been working out of class, and the overall increase is low. And so county administrator and assistant county administrator have moved this forward for approval. And the people are amazing. Our next policy package has to do with the Coordinated Homeless Response Office. This office has experienced a lot of growth since it was a pilot a couple of years ago. At that time, we had the home opportunity plan and equity coordinator, and we hired a project manager and have a contracted grant writer and researcher. Since last year, we've had 2 limited duration staff added there for our flexible housing subsidy pool program. And really need the management of this office to go beyond the health department director directly managing all of the staff and all of the contracts and all of the agency agreements. It is a large body of work. This office has brought in over $9 million in the last 2-3 years. So we would like to make the 2 limited duration positions permanent positions through special grant funding, and add 1 FTE coordinated homeless response office manager. And this one was recommended for funding because this is a really high priority, and we do have dedicated resources to make it happen. So this policy action package, it was traditionally we had an immunizations nurse that was at 0.6 FTE, and throughout the pandemic, we were constantly, I think every year or so, needing to justify bumping that up to a 1.0 FTE, and in that process, really saw a justification and a need to have a full-time person in that position. Turns out that we made the policy option package request, but for whatever reason, because we had been requesting that 0.6 to a 1.0, it was in the CSL as a 1.0, so it wasn't, a change wasn't needed, so it's not recommended. And then finally, last but not least, our developmental diversity does need replacement of a vehicle that's accessible. This is not a no. It is more. It's more of an examination and a need to assess process for fleet. And so we're just going to hold off for about a year until it's completed. And then at the end of these presentations, there's always an opportunity to talk about what the road looks like ahead this biennium. And there's some heavy things on the challenges and some big and helpful things and the opportunities, you know, as mentioned previously, right in the forefront of our needs is to remain nimble and prepared and to engage and for whatever might come our way. the health department continues to have workforce needs and challenges that span far beyond our county. And so we look forward to working internally with our human resources department and with our state and beyond on initiatives to improve retention and recruitment for key positions, and particularly it's our behavioral health professionals and nurses that are especially tough to get and keep. And, you know, I stated fractured systems, and I'm sure there's another way to say that, but sometimes it feels that, you know, our funding or our work really is focused in on one part, when there are so many other related pieces that also need help. So it's just something to keep in focus, that when we're working on something very specific, there's so much more, and sometimes we do need a whole kitchen sink approach, and it's tough. So we have to do what we can with what we have, and advocate and communicate. And then, you know, we have seen, this is a very divided time generally, and certainly in health and in government spaces, trust and confidence are two things that we want to stay focused on. We want to engage with community and hear what their needs are and incorporate their great ideas and improve that trust where we can by being transparent and being honest and being there. So all those challenges can kind of be turned into opportunity as well. As we move forward, you know, in line with the top challenge there, we're really going to be focusing on foundations, on people and on services. It is exciting, you know, we've been able to in the last biennium engage in some assessments that we can put into practice. It's really always exciting when you can operationalize the things that you've been learning about and a plan that you've been working on. So there are some exciting areas there. And then as always in health, in community health, we'll continue to nurture our relationships, to work closely with community partners and with individuals to protect and advance the health of our folks in Benton County.
Thank you. Questions for April?
April, if you could just really quick, like a minute, remind us what the comprehensive health communications assessment is under goal number 2. It was talking about that.
Sure, thanks, Commissioner Wise. The communications assessment has been a project underway within within public health, within the Healthy Communities Division specifically, although our health communications team serves all health services. And so this has been a health services wide initiative. We obtained a contract with Reed Group, a consultant, to come in and really look at how the health department communicates top to bottom, really going into the details of social media to planning and timing to who's included and who might be left out in communications, including accessibility. It's the whole gamut. So that's where that one came from.
Commissioner Shepherd.
Right, I wanted to go through a few of the things. We start with slide 26. So this one, I wasn't aware of this as a goal before, and this seems like a very great and admirable goal. My question is, where's the funding for this comes from? It says anticipated OHA grant.
Thanks. It came in today.
Great. Awesome. Love that. Yeah, this is excellent because, you know, we have a fairly young population in Corvallis, so especially around the university. And I know from firsthand experience, searching for mental health care for people in that age group is really difficult. So I really appreciate this being set as a goal in the budget. You know, that's budgets are moral documents, and this is showing that we understand that there's a need there. So I really appreciate that. Next on page 30, you talked about, this is the COVID investigator, you wanted to put a hold on that. What do you mean by put a hold on it? Meaning not allocate the 110 or, oh, okay.
No, sorry, yes, I hear what you're saying and how it sounded confusing, that was my.
Oh, okay.
So we appreciate that this was recommended and would like to accept the recommendation because these funds may be available for use. If they are, we may very well proceed with this position. If they aren't, we won't be able to.
So this is entirely dependent on Fed funding. And,
Yeah.
Okay, cool. And then on 32, talking about the grow, this is are we really adding 3 FTE or are we making 3 current FTE permanent?
And Commissioner Shepherd, if I might, one thing I wanted to make note of your question previously, unlike some federal funds where are we gonna get it, or are we not gonna get it? These are dollars that actually have already been transferred to the county. And so part of the communication that we have been monitoring is the Timms community call that money back.
Okay.
And so that's why we want to keep it in our budget and we want to continue to monitor, but we just don't know for sure. And I can start the answer in terms of 7 and April, correct me if I'm wrong. These are 2 existing limited duration positions that we have today. But as you know, the LDs only go through June 30th. So what April Health Department requesting is to now make those positions going forward. And then the one position is a brand new position, and that's the management oversight component because the office is kind of huge. So it's really kind of one brand new position and 2 existing positions.
Okay. And under the funding for this, it says public health fund. So is these come in as grant dollars or so they're not general fund dollars, correct?
That's correct. These are, this is the health fund where it takes those dedicated funds and distinguishes them from that general fund, but these are all special grant funds that are, yes, outside of general fund.
Okay. And my final question and or comment has to do with you talked about the communicable disease nurse. They wouldn't be the only person tracking down communicable diseases, correct?
That's correct.
Okay, because as we're getting concerns about measles outbreaks and other outbreaks across the country, I don't feel great about cutting a position of tracking communicable diseases. So.
Thanks, Commissioner. Right now, we have a communicable disease manager who is also an epidemiologist. We have 1 full-time communicable disease nurse on staff, and we have 1 full-time communicable disease investigator.
Okay, thank you.
Commissioner Malone.
Yeah, goal number 3, you talk about 15 units of housing in coordination with Corvallis. I'm assuming that's adding the Van Buren Street property with shiny new Harrison Street property. Is that how you get to 15?
That's right. So these goals are, yes, so first I thought you were talking about rehousing the 15 households. So that is a minimum threshold. There are other things that we'll continue to do with our rapid rehousing and to the city of Corvallis owned property. Yes, that's exactly what I'm referring to, the Van Buren and the Harrison property, not additional properties that have been identified or anything else.
Well, go ahead.
Yeah, I was just gonna, sorry, what I was just gonna add, and I think it's important to note for board commissioners as well as the budget committee that's housed in this is, you might all recall, there was $2.5 million of state legislative money that was awarded to us that still is work we need to do. So my thinking as April's put this goal, that can also be part of that solution. That's not something we have a lot of conversations about. I think April and I have started some with Corvallis Housing First is really to a portion of it, but that is a opportunity, I guess I just want to put out in front of us to really help support that goal going forward.
Certainly, yeah, we've got some good ideas cooking and we'll be conferring with Rick in a couple months here.
My follow-up on that is, do you anticipate opportunities in the future to add to this stock, or is this kind of unique opportunities and that may be it?
Thanks, Commissioner. I don't think that this is the end. I think that this is the beginning of a partnership with the city and with efforts to have that ownership and operation partnership move forward.
Okay, that's good news. And you were questioning your terminology of fractured funding and that a while back when we had Governor Kitzhofer and who knew a lot about the medical system, and one thing I remember from his talk was nobody would design a system like we have. Yeah, that makes sense. So thank you and your crew for dealing with a really difficult funding situation, and I don't think we really needed more complexity and more uncertainty in an already creaky system, but thank you for dealing with it on a daily basis.
Okay. Yeah. No comment. Okay.
I'm good, thank you.
Thank you. April, thank you very much. The next, we have Benton and Lynn County Community Health Centers presentation.
So I'm gonna, while Lacey's gonna, I'm gonna own up to Commissioner Shepherd, who got me and it certainly may make a mistake, but the special health fund we're dedicated under the GROW that is the special revenue grants. So I'm glad you caught that, because that's, wait a minute, that shouldn't be there and be a special grant. So
Okay.
that's why I have, thank you for that question, and Matt missed that one. Okay, we're ready to move right into the community health center, and I'm delighted to have Lacey Malone here today, and I'm especially delighted because 2 years ago I was sitting here next to her predecessor, and it wasn't as much of a fun presentation as you might remember. We were facing a pretty significant crisis 2 years ago. Obviously, we had a aggressive budget and some good ideas, but we really didn't have any strong commitments in terms of resources. And as Commissioner Malone, Commissioner Wise recalled, we had to do a complete resheet of this budget, which is going to factor into some of these statistics when we could get to talking about during the middle of the biennium. And I also just want to start by recognizing Lacey, because under her leadership coming in, she's really inherited a lot of that and has taken steps and congratulations are in order in that, has successfully negotiated some contracts going forward that will really help support, community health centers more than it's ever been supported before. So thank you for that. And she's obviously worried about federal money as well, but, at the same time, that's a good segue into this presentation. So community health centers, again, this is a unique, for, Cody, in terms of it's a little bit of a unique funding, cycle or government type fund. You don't always have community health centers and government. Sometimes you find these in profit or, private in terms of organizations. So it is also housed in an enterprise fund, what we call is basically a business fund. And so it is a self-sustaining, it's dependent on the revenues. And it is by our account, our largest budget that we have in the county. So again, very important that we manage these to a place that is within the revenues. As soon as I find that page here.
This way.
I go along.
Yeah.
All right. So in total, this is a $87.5 million budget. It is an approximate 34.1% increase from the adopted budget. And again, I always like to point out when we see a little bit higher, this is where that reshoot that we did in the middle. So you might remember, for those who can, the two commissioners, we had to completely redo that budget in the middle of this biennium. And as such, we did a lot of looking at positions and starting them halfway through a period of time. And so what you have is sort of a reduced version of the budget, which now makes it, when we fully put that budget together, a bigger distance between the two. So again, I just wanted to point that out. And if you're looking at percentage increases, that's why this one's a little bit larger. And again, that goes into the primary budget driver, which talks about the 37.5% increase. Again, they all also are experiencing the same kind of increases in salaries as well as health insurance. But in addition, as I mentioned, you have that gap or that reset of the budget that makes it a little bit wider gap. They are in a 4.6% vacancy factor into the current service level. That is actually lower than what we had in the previous biennium. I would say, again, this is a self-funded model. So certainly any dollars that are saved stay within that particular fund. They don't get to be used elsewhere. But again, I think that's a very, conservative amount. And I think, we feel good about those dollars, that percentage. Due to the constraints, though, the community health center also has contributed to the same type of reductions as it relates to salaries and adjustments for management. One of the biggest changes, though, again, because of the success and now starting to see the benefits of that new income for CHC, we are reducing what has traditionally been a general fund transfer to support the community health centers. That's a 1.6 million again. That's something that we have traditionally done. And part of the thinking too is with some of the reductions, it hopefully helps sort of offset the loss of that. But again, that's something that is a big change in terms of this particular budget. So all in all, though, when you apply the reduction, it's about a 1.2% decrease to the current service level. So it essentially moves us from what was a 34.1% to a 32.5% increase. So in terms of categorical expenditures, about 60% of this is specifically to personal services. As you can see, the current service level for the CHC includes 160.6 FTE total. But again, I kind of remind you of the discussion in April, we just had 65.95 of those are behavioral health staff that are in the CHC budget, but they are actually part of the health department construct. So, so that's how that entire amount comes out, but it's included in the budget here. Total FTEs reduced in the current service level by 3.97 through a variety of different adjustments. Again, like I said, this has been an active budget in 23-25. Lacey's had to do an assortment of different things to get this to the place it is today. So again, different types of position changes, consolidations, puts and takes, but basically it's about a net 3.97 FTE decrease in the FTE. The growth in contingency, to no surprise, again, we saw that, I think, the smallest contingency ever in the last budget, as some may recall. That was another very big concerning thing when you have an enterprise fund. Obviously, there's not a lot of choices if the money doesn't come, then you're looking at potential layoffs and changes, so it's very, very important to have a contingency. We are, and we'll talk more about this, we're being very conservative, even though we're happy, and we're starting to see those revenues flow. I think we still don't know what's gonna happen on the federal side, and there could be impacts down the road, so being fiscally prudent right now is probably the posture we're trying to take, which is why you won't see a policy option package request from the CHC, even though there is some contingency here. As Lacey and I talked, we hold the right to come back and maybe at some point and have that discussion, but I think we all want to wait and see exactly what's going to happen before we make any kind of request for increases. So again, I've already mentioned in terms of transfers, because we have two funds here, so there's two enterprise funds, we have to keep separate Lynn County from Benton County. So again, in terms of like the transfer, that always went to Benton County, did not go to Lynn County. That is a more separate standalone enterprise fund, but the two of them obviously is all one and they can share between each other. So we do have transfers oftentimes from Lynn County to Benton County. That's where all the money and contingency is put into. We haven't seen that in the past, but we're happy to see it happening this time. And in terms of the transfers and because of the dollars. Let's see, well, materials and supply representing a relatively small share of the total expenses, it will grow about 15.5%. I think, again, there's so many moving parts in a primary care type facilities, a lot of different types of services and supplies. I think one of the things we isolate is pharmaceuticals increases. So again, when you hear us talk about, oh, we put standard inflation in most of our materials and services, this is one of those extraordinary type increases that we likely needed to make some adjustment. There's a big presence as it relates to pharmaceuticals. And as we all know, and you heard from Tracy again this morning, that's one of the costs that we're seeing in terms of raise in terms of our own self-insuring program. So moving on to the revenues piece, again, I've already mentioned that, there's two different funds. I've broken this into three parts of the pie here, just so you can clearly see that, the Benton Health Center, that's the biggest portion. And then the portion you see in terms of the blue, that's a much smaller portion in Lynn. So you have a lot less clinics there. The yellow portion, though, that's the behavioral health side. So again, it's integrated into the community health centers, but it does, you can see, represent a relatively large piece of the pie. So as I've joked with Rachel a lot, and we've all promised her that we're going to do a 101 in terms of CHC financing. It's complicated. There's a lot of things that, and again, I'm so grateful that Lacey is here in terms of her expertise and background, and Chris Campbell, who knows back there somewhere, that just does a really great job of managing and monitoring all this stuff. But both the funds generate, primarily prearranged payments, as you can imagine, from health insurance providers. So there's a billing process that's put in place. I mentioned the billing team. But additionally, there are revenues, and a big portion is Medicaid benefits that are billed out, and those are those negotiated contracts to be able to help supplement other coverages, which they wraparound. That's one of the terms that we hear in the CHC in terms of a major resource. I already mentioned the third bullet here, that we're in the or we have negotiated the revenue increases for the capitation payments for behavioral health programs, as well as for the alternative payment and advanced care model capitation payments for primary care services. That's a mouthful. So that is the new revenue source that is coming in and has really contributed to a much larger contingency now. And as Lacey's mentioned, very excited as we end this fiscal year on a very positive note from a financial standpoint. That's refreshing going forward. Another big piece to this, of course, we're really watching is the federal component of this. There is federal resources that are dedicated to CHCs that comes through HRSA. And this is the part that we're looking at very closely in terms of what is that going to look like going forward. Clearly, if that were to be reduced, changed along with any Medicaid type adjustments, that would be a problem. And something that we would have to maybe look at closely and perhaps take some steps or pivot somewhere. Again, mentioned, there are specific services provided through the Behavioral Health Division. Those also generate resources and have successfully helped to kind of at least keep that portion of that program portion of the CHC self-sustainable moving forward. There's also, again, a variety of different types of state, federal, local grants that come through this. So this is a buffet of different types of resources that come into the CHC, which makes it fascinating for me, in terms of funding, but it is complicated. And it requires a lot of care and take, and that's why, again, I go back to the health business office and why you really need to have a strong team of folks that are focused on this, doing everything they can, taking the right steps to leverage the funds, because that's absolutely critical. I'm not going to go through all of these different parts. I think, what we have again seen in all of these cases, there's been a series of move arounds and changes in it. I think as Amanda over here behind me, the analyst can attest to, she has to always be kind of looking and moving and changing things around a bit in terms of where they go. And with that, you get a little bit of the numbers that you see here. Obviously, all of these kind of represent the same type of CSL increase as the total. There are a few exceptions where you see the navigation, where I think, again, there's been some movement between the health department and the CHC that also has a little bit of an impact, because those kind of really cross both lines a little bit. So that's one of the reasons you see a little bit larger increase in that area. Primary care, again, there was some changes made where I believe behaviorist it used to be a standalone, and it was like moved into along with some of the other services. So again, you can see there's a 0% increase growth in some cases, and there's larger in others. So for the most part, though, this all falls at a 34.1% increase, which again, I think is all reasonable within the different context of the things that we're seeing for the CHC. So with that, I'm going to pass it to Lacey, and I'll let her take it away on the department.
Yeah, actually, if you want to go back to that last slide really quick, just to kind of better understand why some of those areas have historically had their own budget line, was because they were like pilot innovation projects that were grant funded initially 15 years ago or 10 years ago that have now just been fully absorbed in operation. So we didn't feel like it's important for us to track those separately anymore. And so we're just wrapping them up in the most appropriate primary care, dental, whatever service area that they actually serve. So that's why we did that. All right. So thank you, Rick. You did such a nice job. I'm Lacey Malel. I'm the executive director for the community health centers. And as Rick mentioned, my colleague back here, Chris Campbell, is here. He's our data and quality, or data services and quality analytics manager. Chris does everything I ask him to do and finds data to support it. And anyway, he's fantastic and has been instrumental in helping us with this budget reshoot that we went through over the last year and a half-ish or so. So he's available for questions also if you have any. But so kind of just to better understand the community health centers, we're a national movement is funded through the federal government. Our payment mechanism or the payment methodology around community health centers is known as being federally qualified health center. So that's the payment methodology, and then the community health centers is actually the program. The community health centers of Benton County was established in 2004. We had our 20-year anniversary last year. And then in 2008, Lynn County approached us to help expand primary care access in Lynn County. So that's when the county, though the name kind of got established as the Community Health Centers of Benton and Lynn counties, which is a mouthful, and all of our staff tell us that. So we have, 3 primary care sites in Benton County, Benton Health Center, which is on 27th Street, the Lincoln Health Center, and the Monroe Health Center. Both of those are school-based health centers, one in South Corvallis and the other in Monroe. And then we have 2 fixed dental sites, one at the Benton Health Center and then at the Boys and Girls Club in Corvallis. So we serve kids and moms at the Boys and Girls Club. And then in Lynn County, we have 2 primary care sites, fixed primary care sites, one at the Eastland Health Center in Lebanon, and then we have the Sweet Home Health Center in Sweet Home. And as Rick mentioned, we do a very good job at making sure that those budget funds stay completely separate. When we expanded into Lynn County, we qualified for additional expansion federal dollars. So we do have dedicated federal dollars to offset some operational costs in Lynn County because of that expanded access. Again, our revenue is driven by federal designation, so we're eligible for additional reimbursement mechanisms that the state, Oregon Health Authority, is obligated to pay us because Congress wrote that into legislation back in 2000. And then we also have capitation agreements with our local CCOs for primary care services and patient-centered primary care home services. And then, of course, the primary driver behind the Community Health Center program is that we have to serve everyone within our service area, regardless of their ability to pay. So we have a sliding fee discount program that we spend quite a bit of time on and evaluating as a CHC board, which is a consumer-driven board. 51% of our CHC board has to be consumers of the community health centers, and that's a contingent on our grant status. So some of the areas that we focus on, of course, are primary care, behavioral health, dental care, pharmacy, health navigation, and substance use treatment. We do this through prevention, through screening and treatment, chronic disease management, complex illness coordination, immunizations, family planning. We do quite a bit of outreach and enrollment through our health navigation team in partnership with OHA. And then a lot of shift by healthcare payers over the last 5 years have been in assessing and addressing social determinants of health, or the social drivers of health, and ensuring that people have the resources they need to get healthy, and the barriers that keep them from doing so. So, as also Rick and April have spent quite a bit of time talking about behavioral health and our partnership and integrated model. So we have in-scope behavioral health services, which is just a significant portion of our Benton County behavioral health team fall in line with the community health centers. Outpatient behavioral health and all the various programs that they have in that, the substance use disorder team, and then those intensive treatment services and housing support services. And essentially what happens there is those rates that we have negotiated allow us to get recouped at our cost for wraparound services. So anything above and beyond what insurance or Medicaid or IHN doesn't pay us, we have the ability to close that gap through a submission process. And then those dollars go back into the behavioral health program and help sustain that. And then anything excess of that, we are able to apply across continuing to deliver services across all the CHC programs. This kind of shows you a little bit in terms of the org chart, what where we fall or how each of these things fall. So we have the behavioral health division, which you see there's a dotted line there across because it falls under the health department, but then also is in scope with the community health centers. So under the Benton Health Center, we offer primary care, dental, behaviorist, which is different than behavioral health. So it's behavioral health interventions for folks to address their medical conditions, their clinical medical conditions. So, and then health navigation, family planning, and pharmacy. And then in the Eastland Health Center Fund, we just have primary care, behaviorists, and dental services. We don't have any pharmacy out there or expanded family planning. We do have dental outreach though in East Lynn County. So these are the various little are these divisions within my department? I don't know. Okay. These are the cost centers, I'll tell you that, within the Health Center Fund. So we have the Health Center Administration Fund, which is basically all of our senior health leadership, our medical directors fall into this space. This is where we spend a lot of our time monitoring our clinic operations, thinking about strategy and innovation, and all of our contingency fund falls into this budget, which is what makes it look quite a bit more expensive than it actually is, but that's what we have here. And then our next one here is our patient-centered primary care homes. Patient-centered primary care services is a designation that we get from OHA. You can be a primary care clinic and not be a patient-centered primary care clinic, but we aim to make sure that we're meeting all of those quality metrics. So we have 5 locations that are all patient-centered primary care homes. And that is where the bulk of our staff are, so 66 of our FTEs fall into this primary care space. And then pharmacy. This is one of the fun things, I think, and we're quite unique in terms of community health centers in that we have in-house pharmacy, and through partnership with OSU School of Pharmacy or College of Pharmacy back in 2014. Also, they celebrated their 10-year anniversary with us last year. But while the community health centers and critical access hospital, rural health clinics, a lot of different folks have the ability to participate in 340B savings. I don't know if you guys have heard about this. It's okay if you haven't, but essentially Congress allows us to buy drugs at cost, and then we're able to keep the cost savings and reinvest it into into patient care or patient access. So a lot of folks contract with other pharmacies, so the only way they can get that benefit is if they partner with Walmart or Walgreens or Safeway or others. But the best way to kind of protect that revenue stream is to have an in-house pharmacy. And so we benefit greatly from having an in-house pharmacy. We have in-house primary care clinical pharmacists as well that really extend the reach of our primary care team and provide services for for our primary care patients under certain medical diagnoses. They also support the behavioral health team for those intensive treatment folks that need monitoring and medication distribution on a daily or weekly basis. And then, of course, we do deliver medications outside of Corvallis. So our pharmacists drive all across Benton and Lynn counties to take medicine to people's homes. It's a wonderful partnership, and we really do love working with them. But that is, we get a lot of revenue from that program, and it costs us a lot to operate that program as well. But again, this is another one of those that we're really watching about changes that happen on the federal level in terms of how this program is implemented. Health navigation. So health navigation department is made up of community health workers that really primarily assist with insurance enrollment to Oregon Health Plan in the marketplace. We also have folks that specialize in working with special populations like our migrant and seasonal agricultural workers. We have folks that work with veterans, houseless populations. We have justice involved navigators that help assist with folks who are reentering into the community. And they also really facilitate referrals for folks who need additional services outside of the normal primary care patient-provider interaction, and make sure that they are able to navigate the healthcare system well. So that we have about 9 folks that fall into that area. And 9.25, I'm not sure who the 0.25 is, but that's what's budgeted.
A quarter of a person.
It's a quarter. I feel like there's 9 whole people there. Next is our family planning area, and this is really an area where we have a lot of partnership with our public health partners. Family planning has been an area where we have spent quite a bit of time over the last year and a half trying to figure out how to deliver those services across all of health services, but family planning in and of itself is a service that primary care can provide. We also have additional revenue sources through Title X funding and the Oregon Health Authority's reproductive health care programs, RH Care and C Care. Also, we're able to provide free contraception for folks that need it, as well as counseling for people. Previously, we had an RN in this role, and we now have found that we had inequitable access by just having one person. So we're working on making sure that all of our primary care providers and our clinical pharmacists are able to provide family planning services. And dental. Dental is our funnest department for sure, but our dental program has grown exponentially over the last 20 years. Started as a volunteer program and now has 12 and a half team members on board. And we are also just super proud of the work that they do. They are in nearly all of the schools in Benton County and all of the schools in Eastland County in terms of providing dental care and prevention in the schools. But our goal, is to be able to provide low cost outpatient restorative treatment. And in some cases, we do have the ability to provide complex services as well on a sliding fee scale for folks that lack access for that. So dental is a huge access gap in both Benton and Lynn counties for sure. And then our CHC in-scope behavioral health services, again, is about 66 FTEs. I won't go into too many details because April covered this really nicely. But the three areas, if you'll go on to the next slide here, that we, that fall in scope and we're able to leverage this prospective payment or PPS wrap, is through adult mental health adult outpatient mental health treatment, our adult substance use disorder treatment, children and families outpatient mental health treatment, and then children and families wrap services. And then there's also intensive treatment services on the next slide, where our assertive community treatment program and the Early Assessment and Support Alliance, which is ESA, and then supported employment staff all kind of fall into those categories. They are definitely providing intensive services for a smaller group of folks that are the most vulnerable in the community. So that kind of summarizes our services here, and we'll kind of go into our goals. So our first goal, I guess I could kind of preface kind of going into all three of these goals, and April shared the first goal, and I thought, we should have had the same first goal, which is evaluating our revenue streams kind of in the face of uncertainty on the federal and state landscape. But going back to that, what we really are looking to go toward and to really understand is making sure that all of our goals align with the federal statute that gives us the authority to be a community health center. So that 330 of the Public Health Services Act, and making sure that all of the services beyond that we provide, that we're meeting that core measure first. And once we meet that, then we can expand and continue to grow outside of that. But knowing that no matter what happens, either federally or in the state, that as long as we're still coloring in the lines, that's all that matters, right? So to that end, our primary goal is to increase access for primary care services. Our goal, based off of where we have been over the last 2 years, we feel pretty confidently that by creating some standardization in terms of our service hours and some of the service provision templates that we use, that we can increase our engagement by about 15% this biennium. That's our goal, without having to increase provider FTEs. So we have a great team of program managers who have been working very diligently with the primary care teams and our dental team to be able to meet that goal. So we feel pretty confident about that going into the next biennium. Our next goal here has to do with another federal requirement that we worked hard at getting online in this last biennium, which was to make sure that we had an emergency operation plans that were specific for each one of our health center sites and all of our outreach locations. This is a federal requirement for community health centers, and has not yet been a part of the compliance review for federally qualified health centers until this year. So we are very grateful that we hopefully are ahead of the curve as we expect our operational site visit in September with our federal partners. So we just want to continue to make sure that we are updating this appropriately and making sure that all of our staff feel empowered and safe to make good decisions for themselves and for our patients. And then our last goal here has to do with another aspect of the 330 grant. We are a recipient of 330G funding as well, which is a special population with migrant and seasonal agricultural workers. And so we have seen a decline in engagement with our migrant and seasonal agricultural workers over the last year and a half. And with a lot of the uncertainty that's happening in the language and rhetoric on what we're hearing on the federal level and how that trickles in, we are working on increasing our outreach to the communities where these folks are living and being served, and in the hope that we'll be able to increase our engagement back to where we were in the beginning of the last biennium. So that is our third goal there. I mean, I can take this if I want to, but our budget, the summary of our impacts really have a lot to do with just decreasing our the management and non-represented ECI. I do want to point out that in the CHC's case, this also impacts our physicians as well as our managers. So not just the management level impact there. And then, of course, we have that savings from internal service department reductions as well to about $1 million deduction. So we do not have any policy option packages for you, like Chris said. Well, Chris would also like me to reserve the right. Rick would and I would like to reserve the right to come back to you once we start to see more of that increased revenue start to come in, which we have begun to see from the last rate renegotiation we just went through. And it goes without saying that state and federal changes will have a significant impact on our budget should any changes in Medicaid eligibility and the federal funding of our grants and scope of work get changed in any way. So when we think about opportunities, you know, this is the 60-year anniversary for the CHC movement, and there's a lot of momentum kind of going into that, and we want to lean into that. We have been serving the community faithfully for 21 years, and our partnership with OSU is something that we're really proud of, and the impact is profound in our community. We are looking this biennium at increasing our clarity and orientation around our mission, vision, and values, both in the community health center, but across health services, and making sure that we have better alignment and understanding about all these, the intersectionality of the work that we do and how we can better support each other. Challenges are many. It feels like there are more challenges than opportunities these days, but these challenges are really, I have gone back and forth whether resilience is a good word or not, but it certainly has been, it has led to innovation, and it will continue to lead us through thinking about what our priorities are, how we continue to serve the populations that we're responsible for, even knowing that we may not have the same financial resources to do that. Our obligation doesn't change. So that that's kind of the summary there of all the things that we've been doing. I think that's the last slide. I'm open to any questions you guys may have. Yeah.
Questions? Mr. Shepherd?
Yeah, I'll start us off there. It's pretty simple, and I think it's more of a procedural question. So, you know, we're talking about unknowns from at the federal level. At what point do changes at the federal level warrant reconvening the budget commission versus just the commissions? And I think that's a process question for Ray.
Yeah, so might need to follow back with you on this because I want to make sure I get the budget committee being convened. I think that you have the discretion as the governing body, once the budget is adopted, But there are certain percentages, and I can't remember if it is at the initiation of it or if it's turned. So if I could follow back with you on the question to make sure I get, but I also believe you, as the governing board, have the discretion to call the full budget committee together at any point in time if you feel like you want a more inclusive discussion. That is always your discretion.
Okay, thanks. And I think it's 10% is what's in my head, but I just want.
There is a 10% clause, but I thought that was specific to warranting a public hearing of this. So basically, if you go over 10% of a change in any fund, you have to call basically for a public hearing if you were under that, but you as the Board of Commissioners, once it's adopted, that's just you don't have to, it doesn't want bringing full. I'm gonna verify that for you though, Commissioner Shepard, just to be sure.
Yeah, just something to think about and be aware. My only other question, we talk about doing a very diligent job of keeping Lynn County funds and Benton County funds separate. Does Lynn County contribute at all from their general fund, anything to, okay. I think we've had that conversation before, but I just wanted to add it. Thank you.
Mr. Malone?
I think Rick teed up this discussion pretty well as far as you inheriting a challenging budget situation. Would you hit a couple highlights how you helped right the ship and what are our prospects going forward?
Yeah, absolutely. So I'll make this high level story. Like, we had a come to Jesus conversation very quickly after the budget was adopted. No, we went and really looked at, first, we made strategic cuts to our expenses, right? We eliminated locum tenens, provide some really high cost service delivery with low yield in terms of revenue, and looked for alternative ways to do that. And I think even thinking about locum tenens, our medical director, Jennifer Mechek, Dr. Mechek, who also has stepped in and has been supporting the Benton County Jail as their medical director, has really done a bang up stellar job at recruiting our own pool of providers to help cover when we have vacancies or extended absences, things of that nature. So that was one big area. We reviewed a lot. We reviewed and still review every open position, every vacancy that happens. We make a decision whether or not we replace it, when we replace it, how we replace it. From a revenue standpoint, what we knew we could not do was just ask people to see more patients. As just the baseline, you do more work, we'll get more money, because the people that we serve are vulnerable and medically complex, and folks that have a difficult time establishing in other areas or other primary care homes. And so we were looking at where can we increase revenue without increasing effort, so to speak. And that was really going back to Oregon Health Authority and renegotiating our prospective payment rate, which is that clause that Congress put into place that says you have to pay federally qualified health centers at cost. And that was a long process, a big team of folks that worked through that. We spent 2 hours every week in the finance office boardroom for 6 months, working on getting all of that across the board. The application process has been long, but we just, I don't remember when it was actually, but it has been within the last 3 or 4 months where we got our new rate, which is 187 times higher than our old rate. It is a big deal. It's about a $14 or $16 million a year difference in terms of revenue. We have just started in the month of March receiving those payments now, some retrospective payments, and then going forward, our payments moving forward will be at that new rate.
And Commissioner Long, if I might add, to one of the things that Lacey had inherited, as you all recall, was a decision around the House the Health Clinic. You might remember we also had that clinic open in the last budget. That obviously has been a continued discussion, and kudos to Lacey and staff who have continued to have the conversation with Halsey. But I think we did, obviously, it was a tough decision, but it was not a financially viable model. It just certainly was not going to work, and we're going to continue to work with the community. Lacey's already having outreach. This is done periodically. I don't know that that is a sustainable model, but certainly we will continue to help them with alternatives. But again, that was another heavy lift that needed to be pulled in. And then just the sheer amount of adjustments that were made in terms of positions and when to start, and back to the budget was completely just put upside down and put back together. So again, there was a lot of effort on Chris and Lacey's part, and staff as well to really be able to get that configured correctly to get us to this place we're at now, where money is gonna come in and we can fully load that budget to a place and provide the kind of services that we have always intended on. So long as the feds continue to use.
And that rate hadn't been renegotiated since the beginning, since we got our first rate, about 20 years ago. So, and since then, I'm very proud and happy, but Chris Campbell has served on the alternative payment methodology committee with OHA and the Oregon Primary Care Association. He co-chairs that committee, and he meets every week, I think, actually, I don't know, every other week, maybe, with Oregon Health Authority and the Oregon Primary Care Association, helping make sure that all the health centers in the state are getting their rates renegotiated to make, the community health centers a sustainable way of providing primary care across the state.
Great, thank you. No.
Answer, anything? No. All right. Chaz?
No, I'm good, thank you.
Thank you, Lacey, very much.
Yeah, thank you all.
Next is the Community Development Department.
Mr. Chairman, you're doing really great on time. I don't know.
Could
if
we,
he wants a little.
I was gonna say personal privilege, could
Okay.
we take a short break for a second?
And then, right, 4:00.
Thank you.
Okay.
The lunches, there's lunches.
So, Mr. Chairman, it's half hour ahead.
Look at that, look how that works out.
I have a feeling.
A little stretching. Why?
Oh. Yes. Oh. So I tried to, I call them places today, but I'm not trying
I just wanted to.
Yeah, I'm excited, but he seems to be all in. The early read I got from the emails from the representative. He's got. What we want, right?
Yeah, absolutely. I had a check-in with Linda today too, and it sounds like there might be a few days opportunity for you in the city as well.
Ready to resume?
Here, it's on. Welcome back, and we are down to the last two departments. And then we'll have that one department on tomorrow, but we're getting there and a little bit ahead of schedule, so we'll try to stay on pace here. We are at the community development department. And I think as I spoke this morning to financial services, it was the first department that is currently without a director, and this is the second part that is out without a permanent director, but we are blessed to have Petra Sheets here, who has been our interim director for nearly a year now, and has just done a great job in terms of keeping things in place, and so we are quickly trying to recruit for that position, and are hopeful as we get someone else will get that filled, but so as a result, I'm going to tag team this one here a little bit. Petra will do the majority as has been, but there'll be a few areas that I'll jump in. So I'll just kick off the budget component here. So again, current service level for the community development department is 7.37. This is approximately 1.9%, which is approximately 1.9% below. Haven't heard me say this a lot, below the current budget. Now, there is a reason for this. Again, Petra took over a little less than a year ago, and since that time, Petra and I have done had a lot of conversations in relation to this particular department, and you'll hear more about revenues. There is some fee-based revenues here that have essentially gone away and put this particular department in a place where it's heavily reliant on the general fund dedicated dollars. So we needed to try to figure out what steps were needed to be taken to turn that around. Again, for those community members that were here 2 years ago, you might remember this budget had a pretty extensive increase to it 2 years ago. I think we have come up with some smart changes that keeps the idea of the things that we put in place a couple of years ago, but we've also tried to kind of look at the building division carefully. We've been looking at some of the administrative support, some of the management overhead. It did have a deputy director position plus 2 other management positions, so we've leaned that out a little bit. So all in all, about a 3.35 FTE reduction to the current service level. So we've implemented that now, primarily because we needed to. A lot of the revenues, particularly in the building division, wasn't there. So that is where we stand at this point and why you see a 1.9% reduction to this budget. In terms of vacancy factor, we are applying a 4.9% vacancy, which again is very consistent with last time around and matches our historical trends that we have seen of about, again, $282,000. We are proposing a small decrease, but again, this is in relation to the changes that we have already implemented specific or proposing to implement countywide with the freezes to the management and as well as the retirement changes, and then the rest of it is primarily internal service. So that's one component. This one does have a policy package as well. I think I know at least 3 commissioners are very familiar with our comprehensive planning project, phase 1 that we have been in. We are eager to get to phase 2, and so this is obviously a huge county initiative, and we want to continue to see that go, and that is a policy package that's moving through. So when you put it all together, it actually kind of pencils out to about a 3.5% increase to the current service level and takes us from what was a negative 1.9 growth to a 1.5, slightly over 1% growth in the total budget. In terms of categorical expenditures, again, this is heavy on the personal services side, the 74% of it. 16.65 is the FTE that we have adjusted. It was, again, 20 is what was approved or adopted in the 2025-23-25 budget. We do see a pretty significant swing in the materials and services, but again, that's explained by the $350,000 policy package, which again is gonna be mostly likely contractual related services, so that's why that categorical expense is moving up. We did have in phase one, a $75,000 capital outlay component. I think it actually was a bit miscategorized. It ended up getting spent in materials and services, but again, that explains why that is basically phased out and meant to be one time, so that's why you have a little bit of a shift there. And then the other piece, and again, I think, as you see, and I would, point out, at the top pie chart there, you have 4 categorical items, and now you have 2. Obviously, the capital outlay I spoke to, but the big and most important one is that little green slice there, the contingency is all gone. So there is no contingency in this budget at this point, and that has been in the past from our building department. Those dollars have been access to use for current budget. And again, part of that is we again had to control expenses, which I think both Patriot and I worked together to make sure that was in place. But this is also an element, you heard James and Rouse talk about this, document recording fees. We've got building permits. Obviously, when there's not as much happening, we're not seeing as busy time as we have seen in the past. It's still stable, but yet not the same level of building permits, land use fees. All of those are down. And so that's obviously contributed to it. The expenses, again, needed to probably be controlled a little sooner, but we've been able to get those to a place of hopefully now beginning to build the building division piece back. We have also been without a building official. So Patriot is the one manager in the community development department. We are hopefully, knock on wood, close to a building official that will greatly help us in being that strategic thought partner that we need to really start building on opportunities. Again, Patriot's done a great job of thinking out what are the ways that we can maybe be of service to other jurisdictions. Are there different types of IGAs that we can put in to actually provide help and support, particularly if we're in a slowdown mode? Maybe we can help other communities, particularly some of the rural areas outside of Benton County, potentially to be able to help support this. So again, those are things that we're going to be looking at as we go forward. And I guess I sort of just jumped the gun a little bit in terms of revenue sources, but again, just to kind of take off, community development is it's in the general fund, the budget, but is one of those that have the dedicated fees. So again, like James's budget, if fees are good, then basically we have less reliance on the discretionary. If fees aren't so good and they're not paying for it, then we have to take a bigger hit in the discretionary. So again, this department also contributes to some of our challenges in relation to taking some of that general fund. That's no fault of theirs, it's just essentially a fact. And that's the way the budget is put together. So of the total 7.7, as I mentioned, 32% of that is dedicated revenue. Just again, to give you a comparison, it was 57%. So it was over half that was supporting the entire department, and now it's moved to 32%. So it gives you a sense of the impact that we're looking at. Due to much of the lower forecasted dedicated fees, again, we're being conservative here. We all hope that things will pick up again and we can start to see some more fees. Maybe there's some of those service opportunities that can help leverage, but we also be very conservative here. Because we don't want to overestimate and fall short on some of our expenses. So this budget here is the category where there's 3 primary areas, and we have done again back to Patriot and I have been working together to try to get this a little bit more constructed in an organized way. In the past, we had land use planning, we had building permits division, and then we had solid waste. And everything else that wasn't really in, they kind of sprinkled around it. So what we've tried to do is make this a little bit more functional. Clearly, land use planning and building division are two very, very defined areas. We need to keep those cost centers very strict and together, and also it puts us in a place to really look and examine that cost so we can ensure we're getting reimbursed as much as we can for it. So that helps to do that. And then we've actually combined our programs and administration into one area to where you have the leadership component, which again, we did thin down to the deputy director and his or her executive assistant, but then the primary program people, and we'll speak to that as we move into the organizational chart here. So I'll talk a little bit about the organizational chart, and then I'll kick it off to Richard to kind of get more into the division. I invite her to speak for organization chart if she likes. But again, the thing to point out here, we tried to illustrate in the red. I'll put you to that first. Those are the changes, adjustments that I mentioned. So when I said the 3.35 FT, that's where it comes from. You can see we did eliminate the deputy director, or I should say we froze the deputy director position again because we don't have a director in place. We wanted to leave that option open to come back for a discussion. But again, based on what we're seeing right now, there needs to be a significant revenue swing for us to be able to continue to sustain that. So again, as a reminder, this department, even with elimination of the deputy, still has a planning division manager, it has a building division manager, and it has a director position. So there are still 3 positions with 13.35 FTE. So I think it's fair to say that, you know, the span of control is fine as it relates to what we've done or what we've recommended and with the budget. We also had a receptionist position along with an executive assistant. I think based on the examination, you also have mid technicians that are up front that greet the public. But in addition to that, we also had a reception and we also had administrative support. So we really felt we don't necessarily need a receptionist. We feel like we have adequate coverage to meet the needs of the public. We also, again, have looked at 2 areas we looked at, and we had to, was the building division. So again, there was a lot of changes that have been happening in the building division. We did recommend the elimination of the plans examiner because again, with the positions we have with the inspectors, they have the ability to already do some of that plans examination. Patriot's also done a good job of leveraging contracts, if necessary, on how we might be able to get that support if necessary. But I'm happy to say with the 1.65 FTE that we have had in the building division, we've been able to manage everything, at least under the current volume. We do have a vacant position. You will notice there as an inspector. We want to leave that one to the discretion of the building official once we get them hired. But I think based on what we're seeing right now, we probably wouldn't need to hire that. This one we would probably keep vacant until business really demands it. Or, as I said, if there are other opportunities with other jurisdictions, we will be able to work with them. So again, those are the other one was just making a full-time position, Lance Richardson, into a part-time position. We hired him and he's very happy in a part-time type situation, and that works very well for us. And there's flexibility that we can, business gets busy, he's willing and able to kind of jump in and do extra. So that works out well for us. So, and then I guess the only other thing I'll mention is that, again, you see some vacancies. You see that this is a department that we are trying to, obviously, we need to get some staff in place. The director position is out for recruitment. As I mentioned, we're hopefully very close to the building division manager. Patriot has a recruitment out for assistant planner position and administrative specialists as well. So we are in the process of getting this filled. We have been kind of holding out and waiting for a new director to get hired. Because we haven't done that, we just felt like we couldn't wait. We need to start getting some staff because this department definitely needs some some capacity buildup. So with that, I'm going to kick it over to Pedro to talk a little bit more in depth about each of the divisions and the new programs and administration area.
Thank you very much. Again, my name is Petra Sheets. I'm the interim community development director and planning director slash planning official. And then not the building official, but the building division manager temporarily. So like Rick said, 3 management positions right now, but we're doing okay. And just a summary of the organizational changes. We did implement a lot of those about a year ago. So these budgetary advantages have been leveraged over the last year. So we're on a good track there. And they're not only prudent, but it's not affecting our level of service in any negative fashion. So I feel comfortable with the choices that have been made at this point. So moving on to the planning division, there's a summary there on your slide of the things that the planning division does, but I think I'll just use my voice to tell you some of the statistics over the last year. We had over 250, over the last biennium, there are over 250 land use applications that were processed. And we finished phase 1 of both the comprehensive plan and the development code as of the end of this week, on time and on budget. So that was a huge lift. And we're pretty proud about that, especially with the attrition that we experienced. We had an overhaul of our standard operating procedures and administrative organization. So we started cross-training all of our planners so that we could have more depth and coverage. And so that was where we focused a lot of our time in the last year. And I thought that that has been extremely successful and has increased the morale and the interest and engagement that our staff has. And so I just wanted to point that out as a real positive. And we've also been trying to, although we've been forced to be pretty internally oriented because of our organizational challenges, we have also kept our eye on the ball of being more externally service oriented. And so some of the small efforts that we've been able to make was to begin focusing on participating in some long range processes associated with other jurisdictions. For example, the transportation system, safety action planning process that both the county and the city of Corvallis has been working on. So we're on their technical advisory committee and working with the Metropolitan Planning Organization on transportation planning issues and in support of public works and also building our own internal planning element of that. Also the South Corvallis planning process, and there's a North Corvallis planning process in the urban growth boundary area that's going to be kicking off. We stood up the ALSI Citizen Advisory Committee, and so that's a monthly meeting that we staff. And both Wren and North Albany now is interested in standing up their citizen advisory committees now. So there could be another whole body of work at revisiting those CACs. So that's really exciting as well. In the building department, I have a little less to say. We kind of went over that, but just statistically, in the last biennium, we processed over 4,300 building permits, structural, mechanical, and electric. And we have also, Rick already went over some of the changes that we made, but one of the focus areas of having a building official, which hasn't been a position that we've had before, is the idea that we're evolving this into a management process where we evolve this into a more of a service-oriented position with a work plan and a strategy to improve and evolve the business. So that's what we're going to be focused on in the next year or 2 years. Programs and administration next. Okay. And then moving on to programs and administration, that's pretty straightforward. Rick talked a little bit about how we're going to be restructuring that with that central cost center. And I don't have too much to say about the administration per se, but the solid waste program management, there's a lot of exciting stuff going on in that program. I'm not sure if you've spoken about that in the board. Okay, so we did switch the solid waste management program, or the regional solid materials management regional process over to the board's office fiscally this year, but we also have staff in the planning department, or excuse me, community development department that works on that. And so we will continue to work on planning processes, and a lot of that implementation will actually come through the community development department. So that's been a really exciting and successful process here in the last year that we're wrapping up. And the board will be seeing a final report on that very soon. A couple other things is that we've received a couple of grants in terms of a mobile drinking water unit. So we got a unit to do that and implement that this fall. And we had a new coordinator in Bailey Payne, who's done a fantastic job. He has over 15 years of experience in this area, and his plans for community engagement has been fantastic. And so we're really looking forward to an extremely robust body of work in the next couple of years coming around that waste management area. So that's exciting. Stormwater, we haven't gotten very far. It's ebbed and flowed. We were looking at some opportunities as a frozen position that we just hadn't prioritized. However, we were looking for some federal funds to support basically an internship to start that. And those one of the programs that were affected by the federal cuts. So we are kind of resetting and need to think about how we can get that program running again. So that's in a bit of a lull. But the positive on that is that our code compliance officer, after almost 3 years of vacancy, is now in place. And he's done a fantastic job in the last 6 months of getting that program running. He has 14 active compliance cases right now. We've got 85% of those folks have voluntarily complied. So that's fantastic. We're also in the process of buying some software to work with assessment and interdepartmental relationships so that we can identify the short-term rentals in the community, which we don't have statistics on, not only to make sure that they're compliant with the county code and they're functioning properly, but that we know that those structures exist and or they have business license and they're safe structures for the community and such. So it's basically going to be a comprehensive audit of all of those structures. So we think we have up to 300 of them in the community, but that'll be an opportunity for revenue and compliance and safety moving forward. So that was our final goal that we had in this biennium that we're wrapping up before the end of this fiscal year. And move on to our goals. Goal number 1, of course, is pursuing grant funding for phase 2 of the comprehensive plan and the development code. And we're going to do that through periodic review. Periodic review is an opportunity with the state to look at different elements of your comprehensive planning process. And we have, like I said, finished the first phases of development code and comp plan. And we are going to we're going to the state at the end of June to ask them for the funding for this. So it's possible that we won't need to utilize our Plan B, which is the POP that we submitted to the Budget Committee this year. We've had a lot of dialogue with them, and we feel pretty confident that we're going to receive a good portion of the funding that we asked for. But obviously that's not a guarantee. So that's why we asked for the supplemental package, because we know that this is the number 1 priority. Let's see, goal 2, develop and implement the solid waste management plan. So now that the SMMP, the regional process, is wrapping up, we have an obligation to have a county plan. And so we would like to pursue leverage the momentum of that process and pursue that local process. And so I think that that's going to be a great way to continue the potential opportunity for developing an economic cluster around solid waste management and recycling in this community. So that's why we put that as goal number 2, is the economic development potential, as well as the sustainability element of that. And goal 3, we looked at the interdepartmental alliance. Okay, so some of the thoughts about expanding the level of service is, and also partnering with interdepartmental opportunities, is to evolve an environmental planning and sustainability division. And even if it's not defined fiscally that way, organizationally, looking at opportunities to bring together the folks in community development, floodplain, sustainability, water quality, solid waste, that's in community development. And then also the environmental health components like septic, permitting and such, and public works and their environmental work, and pull together a work group so that we can begin working on projects together and leveraging each other's resources. So just looking at the feasibility of doing that so that we can work more efficiently together and expand our sustainability and environmental planning efforts. The 4th goal is to, I mentioned this briefly, is to continue to look at opportunities to incorporate transportation planning. We haven't had a transportation planning element at Benton County before. Our transportation work is all through public works and engineering. And we do have experience. I was a transportation planner for 15 years. And we have 2 of our other planners, that one was a transit planner and the other one has some interest and is relatively new, but also has worked on some long-range planning and transportation, has an interest. And so we have some capacity, and I also worked for NPO for 8 years. So just to supplement the work with a planning perspective, I think it's really important to have both the elected officials, the public works, engineering piece, and the planning piece in a cohesive communication to deliver transportation services in the region. So looking for opportunities to enhance those relationships. And then finally, we're talking a little bit about that code compliance. And this first 6 months have gone so well, we have a lot of ideas about how to evolve the community solutions and code compliance component of the work that we're doing. And I won't go into a lot of details, but we would like to come and give you some ideas about the work plan and some of our interdepartmental partnerships that we'd like to leverage moving forward. So that's our 5th goal for moving forward. Do you want to talk about impacts? Oh, let's see. You can talk about it.
No worries. So, again, I want to just make the point that I made earlier. This is a smaller reduction than what you've seen in other departments, primarily because of the work that was already being done before we even got to the budget. But I also want to just say that this is a current service level adjustment. So you as the budget committee, you're not only approving all of the policy packages and everything, you have the right to disagree as well. So I don't want it to kind of come across as that, okay, this is done. This was really a choice that we made, and that's why people are freezing it as opposed to eliminating it. We had to do it from a revenue standpoint, but we also thought there was efficiency opportunity. So I do want to say that while that has been operationalized, it is still part of the budget, and it still is a choice on the part of the budget committee. But I also would then say, we gotta have money to be able to do that as well, and contingencies all gone. So with that, again, there's just relatively small reductions here where it's related to the 80,000. You do mention the 3.35 FT, and you can see that was little over $1 million of cost savings that we're able to generate. It's not recognized as part of the budget process because we've already implemented, but again, it is significant cost savings. There was a small amount that Beecher was able to kind of squeeze through, about $30,000 in materials and supplies. And then, of course, this one's a little bit backwards just because of some of the adjustments that you see with the internal. They actually had a charge as opposed to a reduction. Again, that's part of the cost allocation process that comes through. But in terms of just overall benefits, I mean, again, I think you've heard both Beecher and I talk, we feel very confident with the approach that we've taken with this reduction. We think that, as she said very well, services will not suffer for this. We still have flexibility in some of like the vacant positions that we can bring on if necessary for the building division. So I think we feel like we're in a good place. As you've, I'm sure, heard from all of the departments, I mean, one of the concerns that, particularly with the COLAs and the retirement reductions, is going to be loss of morale, retaining workforce. I mean, that's going to be a concern with everyone. I think Tracy again highlighted that pretty carefully to this morning to say it's concerning what it might do in relation to that. What that impact could be. Obviously, risk of management turnover is something that we have to always be well aware of. With some of the materials and services, we do feel like we have to be a little bit tightening around professional development, so it could maybe reduce some opportunities, but we still have opportunities to look at online trainings, and we can be a little bit more prudent in relation to how many people we send to trainings. Rachel's already implemented several different initiatives in terms of we're trying to control that, so we don't want to stop it, but we can be more efficient as we go through. And again, as we highlighted, FTE this will not jeopardize service, but it certainly could be a place, because I know community development happens to be always, at least what I observed, is like something comes up. And now becomes all of a sudden a special project. It may not lend itself to that sort of special project. But again, I think in the work that, particularly speak to the planning division, that Rachel's trying to do to make it more of a generalist type approach, is that you have fluid and flexibility within the staff that you have. And I think that's what we'll want to do with the building division. So it's not so, boxed in to be one type of service. So policy packages, just to shift, again, there was a request for one package of $350,000 from the general fund. I want to be very clear that we're pursuing this as a dedicated general fund, as a grant that will go into that as a result of this just obviously being a high priority for the Board of Commissioners, for the county. We have recommended this to move forward. So when you put it all together, like I said earlier, it puts us about 1.5% higher than where the current budget is, so a very minimal growth. This is just a quick summary of the actual package. I'll invite Beatrice if she'd like to speak any more to it, but again, I think she's been very clear in terms of being the Board of Commissioners, the project, and what's next. But if I'll invite her if she wants to add anything more in relation to the POP itself.
No, just that we're hoping that we don't need to use it. So I'm feeling pretty good about it. Sure, so the final slide. Yeah, so challenges and opportunities. Glasses go back on. So, I think all community development departments have the same issue, is the development cycles. They ebb and flow, and they're challenging to estimate. So we're in a lull right now, but things may change. The housing demand is also an issue that's ongoing, that will continue. And so that will continue. Staff turnover has been pretty intense. There's actually been 12 different transitions with 16 FTE in 1 year. That's a lot. We've had 4 admin assistants, just to give you an example of those types of transitions. So we're hoping that we're going to move towards stability, and that's been a big challenge. Coffin Butte expansion has been a major issue and challenge logistically for the county, just because of the breadth and intensity of it. but we're doing really well, I think, logistically and procedurally with that. And hopefully by the end of this year, we will have adjudicated it in one way or the other. And so moving on to opportunities, there are plenty. Like I said, the stabilization of the department operations, really looking forward to that. We're moving in the right direction. And restructuring the permitting processes. We're hoping to reap the benefits of the work that we've done recently in that area. And we completed 100% of all of our workplace dispatch staffing, yes, completed 100% of the BOC goals, despite some of our challenges. So we're pretty proud of that accomplishment this last biennium. And we've retooled the websites and been the lead in the county on a lot of technology pilot projects. That's been fantastic. So we're in a good position to implement those, the best practices, and really increase our efficiency in technology and get more productivity out of the work that we do. And then midway addressing long-range planning work, backlog. We have a lot of opportunities to continue with this long-range planning work that we haven't really leveraged before. And we have a lot more capacity in-house now to do that work ourselves so that we rely less on contracted services. So that's another opportunity for us as a county. And I'm happy to answer questions. Thank you so much.
Questions? Mr. Shepherd?
All right, vacancy factor of 4.9%. I wanted to talk about that because I was looking at the, you're looking at the org chart. You probably hit that pretty quick. And so I was wondering what the thought process was behind that vacancy factor specifically, because, it sounds like you've got some people in the pipeline, hopefully very soon to be a part of the org, but 4.9 is pretty low for what I'm looking at for that org chart.
Yeah, so you said pretty low or pretty high?
I said low,
Okay.
and I think that, yeah, that's what I meant.
Yeah, so great observation. Obviously, there's been high amounts of vacancy, so definitely I will say community development. It's a vacancy factor of 23, 25 pieces, so it's a big part of that. I would hope that never happens again. I think there's some obviously circumstances in relation that contributed to that particular vacancy factor that I also hope that we don't ever see again. That is, part of the looking forward and the complication of that is because it was slightly higher than what we had looked at in the past or relatively close to it. So it probably has some room. We're hoping to have the building official in place by the end of the year. We're going to be recruiting for the community development. So I think that there's an opportunity for the discussion there.
Okay.
I guess what I would say, Commissioner Shepherd, I don't necessarily really disagree. I think that there could be some push there on a potential adjustment to try to save.
Okay. I'll file that away for future thought, but I also wanted to say that I appreciate the comment about doing capacity building now, because it sounds like there's been, again, looking at this and what you said, picture about 16 transitions within 12 FTE, something like that. It was either way, it was a lot of transitions, and it seems like we need to build that capacity in that department. And I have gotten comments from the community completely separate from the landfill process, which you guys have been doing great. Thank you. But regarding like, hey, I want to talk about this thing. I'm like, well, community development would be the people in charge of that, and they're not fully staffed right now. And that's everything from housing to historic resources, and a list of things. And I'm like, there's great opportunities for us to do some good work, and you guys have been doing good work with the staff you've got. But I'm glad that we're making the decision to just try and staff up as much as we can, as soon as we can, so we can get started on that. I mean, the courthouse is looming on the horizon, and I'm sure that CD is going to have a lot of a big role in what to do with the historic courthouse and staffing various things that are going, community events, whatever's going to happen, where we're going to have to make a decision. I'm sure that you're going to get involved in that, and having the capacity to do that is important. So, thank you.
Commissioner Malone?
Yeah, on the $350,000 request for updating the comprehensive plan. And I remember the discussions earlier, and it seemed like the state was very supportive and I think has given us some funding already. Is that correct?
Yeah, so they funded the first phase of the comprehensive plan at $75,000. So we were able to get through that first, I'm sorry, $50,000. The development code was 5. So that was sufficient, and basically a prerequisite for asking for the periodic review process.
Any idea on a timetable when the state might tell us? And I suppose it, different levels of funding. Are we asking for 350,000 and they can adjust that amount depending on their budget?
Yeah, we've been told we're first in the queue. We go to LCDC June 27th. The Department of, or DLCD is going to go with us, and we're going to be asking at that meeting.
Okay,
And the money is released after July 1st. And they go through the contracting process in September.
okay. The other thing is on the boom and bust situation, and I haven't been around that long, but that seems kind of familiar, that's the nature of the beast. A lot tied to new housing or remodeling, and there is a cycle, and I guess as part of the planning process, it would be nice to have a plan going forward, how to deal with that, especially on the bus side where we may have more staff and we can keep busy, and is it possible to multitask and move someone from building inspector to more of some of our other projects to keep them busy and on board for when things pick up?
Yeah, we have quite a few ideas about how to increase revenue by changing our model from kind of a skeletal regulatory model and reactive, as Rick had mentioned, to a service forward model by building our own expertise so that we can provide things like long range planning services and current planning services to other jurisdictions. And it doesn't need to be just to Benton County. We can provide that anywhere. So those are things that we've been working on when we're not processing permits, is building that capacity and experience. And we have an extremely talented planning division right now. And so I think that we're very close to being able to, saying, not just with a straight face, but with a lot of confidence that we're prepared to market those, our experience and our expertise to provide better service in the planning arena to the rest of the community. And it could also be a revenue source.
It just seems like a real advantage to figure out how to keep people, keep them busy, so that when things pick up, we have at least a core group of experienced, dedicated folks.
Exactly. The engagement factor has changed tremendously by switching the focus from the reactive to the proactive.
Thank you.
Commissioner Wise, anything? No? Yes, have anything?
I'm good, thank you.
Okay, thank you very much.
Thank you very much for your time. Appreciate it.
Thank you for your presentation. Next, we have natural area parks and events.
Okay, good job. Thank you.
Move to one. We have reached our final department, and as I said, we'll have a non-departmental tomorrow, but Jesse is cleaning up here for today and for at least 15th department, so and just want to recognize who is kicking this off, Jesse. Well, I can't say that about Jesse, he's done just such a great job with me. This last time, obviously saw some changes and turnover there, and under his leadership, he's really taken a little bit tenuous situation and really straightened it out and gotten stability, and I can't say enough about the work that he's done. And helping us get to where we need and really thinking through a lot of, just being very strategic, a strategic partner, and again, just wanted to start with that. So we will jump right on in here to natural areas, parks and events, proposed budget, and give you a quick overview of budget wise. And this is always a fun budget for me because it's got a lot of moving parts in this particular budget. A lot of enterprise funds, a lot of trust funds, a lot of general fund, a lot of fair fund. So we got a combination of things here. So this is a $12.9 million budget, which is approximately 13.6 above the adopted level. Primary driver is about 8.8% increase in personal services, salaries, PERS, and health insurance, of course. This has a vacancy factor, and this one has been a little bit challenging for us in terms of to actual vacancy factor to put in. And I know here in relation to the presentation, it provides for an 8.4, but as we kind of have looked at this closely to determine it's really more like a 7.9, and I explained that because there's some adjustments that Jesse and I had to do at the last minute to get this right. So I apologize, and there's a little bit of art to completing that. So on the sheet that I had provided you last night, that should be the most accurate up to date, and you see the current service level on that is 7.9. And I'm just going to quickly jump because I don't want to forget this. Part of the proposal in the budget reductions for Jesse is moving from a 17.9 to a 13.9. And again, as you all know, there was some transition within our department, and I'm happy to say most everything went through pretty nicely, but there was one adjustment that wasn't made, and that was in NAEP. And I want to point out this 13.9% vacancy I am concerned about. I think that is way too high for a department of only 15. And last time, you might know, he was at an adopted level of approximately 8.3. So I want to put that on the table, that and that's due primarily because of this transition happened, and we thought we had just about everything, but that's nobody's fault. It just happens. But I do think we're in a situation where we're going to start talking about adjustments. This is one I'd like to at least flag for you for discussion as we go forward. So with that, outside of that particular piece, there were some other adjustments that were made in addition to the ECI changes, as well as the retirement. There was and you've already heard about this, another one to flag that has a lot of discussion is reduction and transfer to the sheriff's office inmate work crew program. You heard about that yesterday. So again, I just as a reminder, as that's been a general fund, Parks is a general fund program transfer. So we transfer general fund to the sheriff's office so that they can then have revenues to pay for the program. In discussion with Jesse, no decision is easy ever with this, but we really felt strongly that never a good choice, but this is the one we can continue, at least with his current park staff, to maintain some level that is still, quality service, and, so. And nobody likes to make those cuts, but we made the conscious decision in the sheriff's office budget to leave that there and really bring this to the budget committee, because they clearly shared with you yesterday, they don't know at least an option to fill that revenue void right now. And so that'll be something we'll have to talk about. The proposed budget does recommend a small increase for policy package. Again, we can talk more about that, but that's an existing, no add, but an existing limited duration position. Our fair manager, who I think all of you have gotten to know, has done an outstanding job out in NAPE, and we want to make sure that that is permanently put in place. So after you make those adjustments that I had mentioned, it brings our, it's about a 4.8% decrease to the current service level, and ultimately we end up with, rather than a 13.6 total increase of CSL, we end up with 80.1. So that's a summary from the budget standpoint. Categorically, again, like I said, this is always a exciting pie chart to present, because it's got so many different sources of funding. And see, Jesse's got contingencies, transfers, personal services, he's got it all. This is another one of those budgets like Public Works where it's different than what you've seen. Rather than personal services, it's capital outlay, materials and services. Probably no surprise, obviously you have folks that are working in the parks, in maintenance type work, you have a lot of fair activity that is contract services related. So again, 55.4% of that budget is actually materials and supplies and capital outlay, focus on those areas that I mentioned. In addition, and we'll talk a little bit about, there's a lot of capital improvement as well. Parks, the fair fund is actually a recipient of 70% of our transit lodging tax by county code that has to be used to promote tourism. So much of that decision for those resources that have been put into capital outlay improvement. That's something I marked for you early on that we do need to talk about, because that is changing due to the need of reliance on those dollars, and might be an opportunity for us to talk about some options going forward. The budget holds the position at 14 with no additional positions recommended. Again, very little change between materials and services and capital outlay. Transfers out are decreasing by the 59.3. That's because of the work crew transfers. So you take that out, that's the reason you have that shift. And then contingency growth is from surplus transit lodging funds to support future tourism. So we don't typically budget all of transit lodging tax that comes in. We have budgeted a contingency for decision making, particularly around for the board, particularly around other capital improvement projects. So I want to say there is a contingency of transit lodging tax in the budget as we speak. It's approximately $650,000. So as we start talking about options and opportunities, that may be something we just want to for discussion. So again, great mixture of funds. Jesse by far has the most funds of anybody, of any department. He has a general fund portion, which is mostly his parks and facilities grant maintenance folks at 44.8%. That is all discretionary. It also includes the Habitat Conservation Program, which he will talk about. The fair fund makes about 35.5% of the resources that come. All of this is, when we say the fair fund, it's really kind of two parts. It's the what we call the operations component, in terms of leveraging the fairgrounds for rentals, for events, for all kinds of fun things. And then, of course, we have the annual fair as well, which is also its own separate cost unit. We have a cemetery operations funds. I know, I'm joking with Commissioner Shepherd, he didn't realize we had a cemetery. And we actually, we talked about the cemetery operations, and we've had that in place. Jesse's been having some conversations about that, and maybe there's some future opportunities with the cemetery, and maybe some other ownership that may have some interest in helping us out, because it is an area that it's pretty lean in terms of revenue, and the cost I'll say pretty much the cost exceeds some of the revenues that we get there. He also has a sort of enterprise operation fund, so the business accounts, we've got obviously Salmonberry Campground, Adair Clubhouse, Benton Oaks, we have the new McBee campground that is also part of that. And you will notice that we have the LC guard station there as well, and that is still in the budget. I think, looking at Jesse, I think we're gonna ask for an adjustment in relation to that because Jesse has successfully moved that along. I'll let him talk about that, but that is, it's small, but it is a budget adjustment because it happened after we had put this together. Again, the general fund portion of the main budget includes 11.4% of resources dedicated to the department. In total, approximately 60% of the budget is supported with dedicated resources. So again, a good share of it is all dedicated. So again, some of this will get called out as Jesse goes through his presentation. I won't obviously look at the bigger numbers, the bigger changes we're seeing. The few that I would point out, I mean, I would look at the sanitary and enterprise operations. Some of that is just again related, it's a small amount of money, but costs have increases, so it doesn't take much to put that in, but some of it is also related to additional enterprise activities such as, and the biggest thing is McBee. So again, there's resources there. Matt Jesse's gonna be taking over some renovations on McBee in this binding, so that's the biggest driver in relation to that particular, more resources and more efforts that need to be put forward on that. The transit lodging tax, again, just to kind of call that out, the 14.1% reduction there. I don't want that to alarm you too much. I mean, it's a relatively stable amount of dollars that we've gotten. The primary part of it is that we've had to use it. And as I mentioned before, and we'll probably continue to use it unless we start to think about, is there revenue opportunities we need to take advantage of in the fair fund? Because right now, the fair fund is having to use transit lodging tax. I should say, I'm sorry, the fair operations and the fair itself are having to utilize some of the transit lodging taxes to make it a whole. So again, it's all in the fair fund, that's part of it, but best way to say it is right now, the transit lodging tax is subsidizing both the fair and the fair operations. And so that is talk to Jesse about, are there opportunities, are there things that we need to do from a revenue standpoint? But that is a trend that's growing and changing. And so as I mentioned in my budget message, mostly we're talking about general fund. But I think the fair fund's one we need to pay attention to in relation to this, because I know traditionally the transit lodging tax has been one we want to hold aside to really focus on capital improvement. All of that, the use of this money is absolutely appropriate. That's not the problem. It's just that it has traditionally been thought of to be set aside for other bigger type capital projects, and that's just. If the trends continue, it's not going to be possible to continue to do, maybe not as much. So just wanted to plant that seed there. Okay, I think with that, I will just turn it over to Jesse, let him to get into the org structure and talk a little deeper about some of the different areas.
Okay, great. Thank you, everybody, for having me. I'm Jesse Ott. I'm the Director of Natural Areas, Parks and Events. All right, well, thank you. And thank you for all the hard work with this. I know it's a lot, and I know how much Rick has been working on everything for sure. Looking at our current service level, that's our department makeup there. You'll see the highlighted program coordinator position. So what that is reclassification of our deputy director. When I fulfilled that role, we didn't backfill it, and we wanted to hold that position as a program coordinator, largely because we had two directors managing both sides, and it could easily be staffed that way. But to get some cost savings in order to make our fair manager permanent and use some of those deputy director funds a program coordinator would be a great position for us. And that's largely due to a lot of what we're going to need to do. Most of our needs right now are facilities. We have a ton of aging facilities. A lot of these projects are going to be kind of long-term, grant funded, community funded programs. And so just to be able to keep all of those moving along, we could really use the program coordinator. We have our fair manager and the admin staff, our maintenance manager, and the maintenance staff, and our natural resource coordinator that handles our forestry, our natural areas work, and primarily works on the habitat conservation plan work. Okay, so department administration. So this one covers everything you see there. We've got a very busy office, a lot of people coming in and out, a lot of people looking to inquire about different events that they want to put on, research at our natural areas, and with all of the facilities that we manage and all of the different cost centers. And, Rick mentioned that, we've got 14 different cost centers and 5 funds. So it's quite a task to keep all of that separated and track all those funds. And, it includes a lot of things like holding deposits and returning those for rentals and things like that as well. And then we also do sponsorships for the county fair and our outdoor recreation programs. And so I see on there we have Avery space costs, and we actually are in the process of moving out of the Avery building. And part of the thinking in that would be to reduce our so what we're doing is taking our offices out of the Avery building. We'll still house our maintenance staff there where they have a shop and all their equipment. But the natural resource coordinator in my office will be moving to the fairgrounds, and we're building a new office in the old fairgrounds office in the front of the auditorium. And the thinking behind that was working with our facilities department in that we would be able to save those charges in our department. And with any luck, facilities would be able to lease out that space to an outside agency, further reducing the general fund need. And so you see on there our outdoor recreation program. So that encompasses a lot of different events, public events. Even tomorrow is OSU Family Day out of Bazell, where we get several hundred kids that come out there. We do a summer camp, a week-long Benton County Adventures. And so that's when you look at the Corvallis activity guide, we're one of the primary providers for rural families in summer recreation. We also offer a 10-student scholarship to families in need in the county, focused on rural areas, to do our summer camps. So our natural resource coordinator manages a lot of the summer camp things and take the kids out to all different kinds of park and do fishing and hiking and all that kind of stuff. So grounds and park maintenance. So this is kind of the biggest chunk of what we're responsible for. And you can see it's managed by 5.3 FTE. Those are the folks that are out there doing the work. And we're kind of unique in NAPE in that we don't receive any support from the facilities department. Every light bulb, every doorknob, every office move, every parking lot is on us out of our budget for all of our structures. And so with those structures, we have 66 buildings. Those are all structures with roofs, not counting things like kiosks. We have 30 restrooms, 9 historic resources, 5 boat launches, 3 campgrounds, 20 park locations, 4 habitat sites, 1 large restored wetland, 1 large cemetery, 5 public water systems, 6 septic systems, 3 playgrounds, 3 rental homes. Now, these rental homes are properties that we cannot divest from based on the agreements in land donations or that type of thing. And so we rent those out to bring in revenue, and we're working with Coordinated Homeless Response. I'm glad to hear that someone's calling them Crow, because I thought Nape had the weirdest name in the county, but Crow is up there with us. So talking about finding a way to utilize those rental homes and also achieve some of our other goals with housing for folks. So we're working together to try to work on something that we could better utilize those rental homes. We have 1,700 acres of parks and forests, 26 miles of trail system, over 20 parking lots, 7 bridges. And in order to manage all of we do all of our own custodial on all of this stuff as well. And so in order to do the turnovers, manage all the facilities at the fairgrounds, do all the cleanings and setups for events, that basically takes 2 maintenance workers to do that on a regular basis, barring a little bit of time that they can help with the parks. The remaining items that I mentioned are covered by 3.3 FTE employees. Pretty remarkable what they're able to pull off with such a small staff. But the grounds and park maintenance, we get a lot of support from the Alliance for Recreation and Natural Areas, a support group, kind of a friends of group that helps us with county projects. Even this year, they've donated $55,000. And the Rotary Club also donated a significant amount this year to help us with trail improvements. So that's our grounds and parks maintenance division. So fairgrounds operations. Primary source of revenue is rentals. We do RV storage, we do rentals of facilities, we help facilitate events. And so we have our events and sponsorship coordinator who, if somebody's looking to host a conference or something like that, and they don't know where to begin, that staff member kind of walks them through the process. And so COVID definitely affected rentals a great deal. And in fact, Fairgrounds was closed for a significant amount of time. So we're still kind of rebuilding from that. But the fairgrounds operations, a lot of aging facilities and trying to implement the fairgrounds master plan, which was quite an endeavor. And we're still trying to move that along. We're making steady progress. But some of the remaining items are some of the bigger ticket, more challenging items to overcome, like converting the rodeo arena into an exhibit hall. So with those over 1,000 yearly events, they include ski swaps, 4-H groups, Corvallis Indoor Winter Market, 5K runs, Master Gardener plant sales, soil amendment sales, library book sales, corporate events, quinceaneras, religious group events, rodeos, concerts, and conferences. We're very lucky over there also to have a second nonprofit support group that helps us with the facilities projects out there called the Benton County Fair Foundation. And so even within this biennium, we're close to over 250,000 in direct or indirect donations from that group as well. And so they're a really great bunch of advocates to have on our side, kind of helping us with very facilities focused, trying to do upgrades on facilities. Okay, the annual fair. So everybody loves the annual fair coming up July 30th through August 2nd this year. And a large portion of that fair funding comes from a transfer from Benton Oaks RV Park, over $200,000. And we get an annual contribution from the state through the Oregon Fairs Association as well. So our fair has been going on since 1913, where Benton County officially took it over. I think it actually started in 1904. So we're on the 122nd year of the Benton County Fair and Rodeo. Also at the annual fair, we're the host of the Lee Allen Memorial Auction for 4-H, which is the largest single-day fundraiser in Benton County. And we're also home to the unique all-girls rodeo. There are only a few other of those in the nation, and we're home to our 4-H partners as well. So annual fair is very interlinked with Benton Oaks RV Park because of that funding component. And so I'll talk a little more about that later in the presentation. So transient lodging tax. So we are trying to get away. We don't want to use the transient lodging tax for any operations. We really want to avoid that. You know, so a lot of our work for the next biennium will be to make sure that the vast majority of our transient lodging tax, if not all of our allocation, will be economic drivers, very focused on that effort to implement the master plan. And so that master plan was quite an endeavor. It was a big process that had a lot of different partners, but you know, even by 2019, it was indicated, estimated between Visit Corvallis and all kinds of economic development groups that we worked with that completing that master plan would have an annual economic impact of Benton County somewhere between $1.2 and $2.2 million and support between 10 to 17 full-time jobs in Benton County. So that transient lodging tax is really important to kind of make sure that our fairgrounds remains vibrant and can be utilized for economic development in the county. So the Habitat Conservation Plan is kind of one of those things that kind of goes behind the scenes, and a lot of people might not realize all the different parts that are involved. This program is directly related to bringing a couple species of rare plant and butterfly back from the brink of extinction. Some of them thought were extinct in the 1980s. When you're talking about some of the vegetation and our butterfly population, Benton County is very unique in the entire world. We have the largest population anywhere in Oregon. It's at Benton County, and not just Benton County proper, but Benton County natural area sites. And so the Habitat Conservation Plan, so there's another component to this. So there's a lot of sustainable forestry, native habitat protection that are involved with the Habitat Conservation Plan. But we are also the holder of this plan, and we manage it for the county, for the city, and for Benton County Public Works as well. And so we work with U.S. Fish and Wildlife, and the Habitat Conservation Plan is one of those things where if we didn't have it and Benton County was trying to build a new courthouse or a bridge and there were listed threatened and endangered species there, there wouldn't be a mechanism in the county to continue to build. It would basically be a stop. With the Habitat Conservation Plan, we can allow Public Works, NAPE, and the city of Corvallis to continue to do public good infrastructure projects while we mitigate the effect of those projects at our habitat sites. So that is a challenging budget kind of across the board. Even, you know, we're looking at some different options this year to kind of bring some of the costs down, because we have a lot of responsibilities with this to U.S. Fish and Wildlife to maintain that permit. And so if they come down and do an inspection and they would like to see more weed eradication, we have to deliver in order to keep that permit, kind of regardless of what our budget is. So we have to get creative and figure out ways that we can do it. And even right now here at the end of the biennium, we're kind of running on fumes on that account. And so typically we would hire a company to do some very targeted spray work with herbicides around some of these sensitive plants. And for the first time in many years, we've got the crew out there with backpack sprayers to save some funds to do that type of work. So we're always looking to find ways to be more efficient with this, but this is really, the Habitat Conservation Plan is really a gem of Benton County and accounts for a lot of our habitat protection. So cemetery and enterprise operations. So these are all the little businesses that we have in NAPE. And Crystal Lake Cemetery, I think I was just reviewing all of the old commissioner minutes from that. And I think even back when we accepted it, in 2001, there was a lot of concerns that it was going to be tough to make money on it. And I can assure everybody that that's still the case. Nothing has changed. It's very hard to market the cemetery to make more money. So we're doing our best. Yeah, we're doing our best. There's a lot of cherished historical resources there for sure. And so we try to promote that as much as possible. To at the very least, bring that to the community and allow them to see our county's history, through the cemetery. But we are in conversations, now about a potential buyer or manager of the site. So those are very, they're just kind of in the early stages, but the cemetery is a beast, and the documenting for that and the archiving for it is pretty extreme. Everything is permanent. We'll get people that give us a call and say back in 1905 that somebody in their family had bought several plots and they're here to cash in on it. And we have to figure out who paid for it, where they go, and try to find that documentation. So if we can get this off of our books and just maintain it as a historic resource and get out of the cemetery business, it'd probably be a good thing for the county and the enterprise accounts. Campground operations. So Benton Oaks RV Park and Salmonberry Campground in LC. Very popular. By tomorrow, the campground at the fairgrounds will be full just due to the baseball game this weekend, and Salmonberry Campground's booked up through July. So, and from the generous donation from Hull Oaks, we received the McBee Campground. So right now that's a day use and hiking area. We've got a allocation of $645,000 from Oregon State Parks to rehabilitate the campground, install new restrooms and fire rings and all that kind of thing. And that's going to be a challenge, because starting something new like that, we don't know exactly how successful it's going to be, how popular it's going to be, and what all the ins and outs are going to be to manage that particular site. So, but it's exciting to know that that's coming up. So for all these campgrounds, any campground we add that can accommodate RVs, we get an allocation from the state based on the number of sites that we have. So this will be another driver for us to help maintain that campground as well. Altsea Guard Station, so Rick had mentioned that. So we had prepared this budget, and in the meantime, I called the Siuslaw National Forest to do our annual walkthrough, and they let me know that they needed that site back for workforce housing for wildland firefighters. Yep. That's what the site was originally for. So we've been a good concessionaire, and it's been a good run for us, but they're taking it back. And so we'll be able to get that off our plate. It's a little bit of a loss as another recreation facility. But I think for the county overall, the staff time that it frees up, and it was also very challenging to make that cost center profitable. And then we have the Adair Clubhouse. So that is attached to the old Army Air Corps donation of Adair County Park. And so that's a park in perpetuity space. We cannot divest of that facility. Very aged, recently has gone up through an upgrade though, and looks much, much better. And so currently we don't have the staff to manage that as a rental facility on our own. So we rent it out to a concessionaire. So most of our funding for that cost center comes in strictly from rent from the concessionaire that does a catering business and event business out of the structure. And I think that's all for cemetery and riverbanks. Okay, the trust fund, the Bazell Memorial Forest. So this is one of my favorites. So this is our only trust. So any funds that we bring in or spend stays in that one, aside from different internal service charges for support of the facility to the county. So the forest stewardship plan, is a big document. So we practice a lot of sustainable forestry. We're one of a handful of counties in Oregon that manages their own forestry projects. We've had huge successes out there. Great timber harvest, great habitat work. It really serves as a shining example of what sustainable forestry can look like. And then we have the Bazell Memorial Forest and Education Center there as well, where all kinds of weddings, events, and a lot of educational groups like to go out there so they can pair it with the forest to go through there. So we do a lot of, we do the senior sleepover for the LC charter school, OSU Family Day, Mushroom Day, and lots of habitat work. So we bring in funds from renting out the education center, but then we also bring in funds from timber harvest. So we're very careful to try to time those timber harvests where the market is beneficial for our account. And any harvest that we do, we follow it up with either a habitat restoration project or a sustainable replanting of Doug fir. Okay, so you know what, the one thing I would like to, and I apologize, when we were talking about park maintenance, one thing I forgot to mention is that we also manage the grounds landscaping on every county facility, not just NAPE. So every health center, every satellite building, this building, the other buildings on Research Way are under our management. So that comes out of a transfer from the facilities department. We are not able to keep up with that level of service and maintain all of our other things. So it comes out of the uniform rental rate. So it's spread across to all of the different groups. And then we contract out the kind of day-to-day mowing and leaf blowing and that kind of stuff that happens to keep a facility like this looking good when people show up. But then we also manage on our own all of the irrigation systems, tree and plant care, tree pruning, all that kind of thing. So my apologies, I forgot to mention that before. So going into the goals, by June 30th, 27, convert all fairgrounds lighting to LED. Anybody that's been following LED lighting requirements in Oregon, we're already behind the 8 ball on this one. We can't even buy the light bulbs that we need for the fairgrounds right now. So we did put in a policy package that didn't make it through, but we still feel like that we can come really close to cost neutral on this one with the type of rebates that we need to do. But this one's essential. We got to get on this right away because pretty soon we'll have to have clandestine trips out of state to get the light bulbs that we need. So we need to do the right thing. Yes, okay. But we need to do the right thing anyway. We're always looking for resource efficiency. So converting to LED is one of the ways to do that. So for goal number 2, we just want to increase kind of the community engagement there at the Benton County Fair and Rodeo. So we're hosting a community stage where we're offering different cultural groups, different community groups. It can be anything from taiko drummers to a dance troupe to native storytelling, all for free. Any group that offers, we'll load them up with fair tickets and any kind of thing we can and get them in there and they can perform and kind of educate the community on what they're doing and hope to kind of create more cross-cultural engagement there. This one is very specific, but it's a heat pump system at the Bazell Education Center. Part of the reason that this one ended up becoming a goal was not only the cost to run our current system, but we actually lose money on that particular, just the facility itself in the wintertime with the cost. And so NAPE tried to keep it closed in the winter, but we heard from the community that that was not ideal. There were too many community groups, there were too many schools, there were too many weddings, there were too many other events that people really wanted to do at that space. But we were losing money depending on how cold it got in the winter. And so a much more energy efficient system there will help us be able to keep it open all winter long, all year long, and also reduce our energy costs. Okay, so we know that new threatened and listed and endangered species are going to be entering the habitat conservation plan based on U.S. Fish and Wildlife. We don't know exactly which ones. We're expecting sometime in 2026 to have the full list. Since a lot of that program is under their purview and we manage it, it kind of emanates out of the habitat conservation plan. A lot of education to community partners, soil and water conservation districts, the city, and what we need to be doing to protect new and threatened, listed and endangered species that they tell us to keep an eye out for. And so we've started on this. And this is about emerald ash borer, and not just emerald ash borer, but spotted lanternfly and some of the other invasive species that we're finding in Oregon now that'll have devastating ramifications. And so we want to kind of get OSU, the city, soil and water conservation districts all together to do a community action plan for emerald ash borer. And so a lot of the actionable things will come from the state, but as a county, we all need to be aligned on what we're looking for and what our approach is going to be. If you think about a place, if anyone's been to the Jackson Fraser wetland, all the trees you see out there are ash. And if emerald ash borer comes, we could potentially see that entire forest wiped out. So we need to be prepared on what we are going to do about it. Okay. So the impacts, I wanted to talk about the corrections work crew. That has been one of the hardest decisions that Rick and I have talked about extensively. One of the more challenging things that we've ever really addressed in NAEP. NAEP and Benton County Sheriff's Office have really deep connections with the Sheriff's Mounted Posse, the Forest Patrol, Emergency Management, and the Reserve Deputies. Currently, the corrections work crew is housed at the fairgrounds. So they take some of our space in one of our offices and keep all their equipment there. And so starting in 2019, it used to be a 50-50 split with Public Works and Parks and Natural Areas. Then due to some budget issues that Public Works needed to address, they opted out, putting all of it into the NAEP budget. And I know that they also receive outside funds from things like Republic Services and other groups that they work for. But when Rachel asked us to do a 10% reduction exercise, we started looking and kind of whittling it down and trying to come up with options on how we could make this work with our general fund in NAEP. And in NAEP, the general fund is largely programs like Habitat Conservation Plan that we're obligated to do, and things like the personnel, the trucks, the gravel, the paint, and the tools. It's really, when you look at our parks maintenance budget line item, that's basically what it consists of. Contracted services that we can't do, the materials and supplies like buying all the toilet paper and custodial supplies, and fuel and the vehicles to get to all these places that many of our sites are at least 45 minutes away from Calapooia. So that's a challenging one for us. But when Rick and I went over all the different possibilities, it was tough to get within the range of general fund reduction without losing current staff. That was kind of where we were left. And, we wanted to follow Rachel's guidance too on doing whatever we could to avoid that, if at all possible. And so, looking at it for us, we see the corrections work crew as an extension of our staff. They're there with us on site. We see them every day. But it's a big challenge. So realistically, with the budget allocation there. We get 2 days of work a week. It can be dependent on who shows up for their community service that day. Get 5 really great workers, we get 1 person that can barely do anything. It can really depend, but we do depend on them for a lot. They're kind of the blunt instrument in our toolbox. Leaf pickup, a long day of line trimming along a roadway, garbage. People do fireworks at the 4th of July out in the fairgrounds parking lot, and there's paper and garbage everywhere, stuff like that. So it'll be a big loss because we'll have to pick up all of those things somehow through our volunteer network or our current staff. But for those 2 days a week and the charges that come through, it costs us about $2,600 a week to keep the corrections worker operating. And so if we could find another way to do it without losing that, because it's a loss to us, and we know the community really likes seeing something like that out there when those folks are out working. But if we found another way to get to those levels of numbers, we would. But currently, it looks like the closest we could get was losing a staff member. And so that was a really tough challenge there. There's the same challenge. Yes.
Sorry.
Yes. Yes, and so, but I think my message would be that we're typically very good at operating pretty lean. We have a lot of community supporters that can help us out. We have a large volunteer network. So we're very grateful that our community really cherishes these spaces and are willing to put their funds and their labor behind helping us. And so we'll dive deeper into those connections and resources here in the next biennium. And I think we'll be able to have a great couple of years. Yeah, I would say so. So the packages that were recommended, so we're looking at a 4% decrease in our CSL budget. The one that was recommended is the continuation, make the fair manager permanent. And so we're looking at about a $622,900 decrease in our NAEP budget. Proposed budget is 8.1% higher than 23-25 adopted. So our fair manager, Jennifer Martin, is doing a great job. It was initially a limited duration hire. And we really need this one. If we don't have a fair manager, it starts to get to the point where I can't cover everything that we need to cover to manage all of both. And so this is not only our fair manager, this is also our office manager that manages all of the office functions relating to parks, natural areas, including the fair and fair operations. This one, so this was a partial recommended. So this is a maintenance technician for the weekend. So this would be somebody who would do something like a Thursday through Sunday type shift. A lot of that is related to our on-call. With such a small amount of maintenance workers, in order to transition through an on-call phone on the weekend, and these people are having huge events. We'll have OSU tailgaters on a football game day. Well, it'll be hundreds and hundreds of people out at the fairgrounds. And if something happens, we have to be able to respond to it somehow. There could be an emergency at a campground. We just have so many active events happening on the weekend, and we've implemented a on-call procedure, but it's really burning the crew out. I mean, you're talking about being on call one weekend a month with the amount of staffing that we have. And so the reality is I keep the phone and the maintenance manager keeps the phone, and we respond to calls on the weekend. That could be anything from somebody's having their wedding and the toilet clogs. we got to deal with it. It could be that they blew a breaker at the Bazell Education Center and now nobody can do a presentation. It could be, all kinds of stuff can come up. And so that one, we can get by, but it's been a challenge for us and it's something that we hope to resolve here eventually. Project coordinator, so that one was recommended. And again, I think I had mentioned that earlier. We just have so much of our work is going to be based around a lot of our parks. The shelter you see is the shelter that was the first one that was put in the 70s, or, and so a lot of these facilities are very aged. And so we're going to need to really tackle a lot of private grants, public grants, and a lot of coordination to manage all these projects between the McBee campground. We're going to have a large role in the historic courthouse use, when we move over to the new building. We're part of the Owens Farm project. We're in transportation planning efforts. And so that would really be a big help to help coordinate all of that so that we don't lose track, because we're really juggling a lot of grants and different cost centers.
Mr. Chairman, if I might just jump in real quick, just for clarification on the second and third policy package, because they go in tandem. So initially, like Jesse said, he asked for a new position in package number 2. It was for 236,000. Package 3 is really, as you notice, a reduction. So what he's doing is he's taking his existing deputy position, he's asking to downgrade it, which creates a savings. What we did is the reason of partial funding for number 2 was we made it basically a wash, and we were able to fund temporary services for Jesse. So again, as opposed to a position, we did not create a new position, but what we did is we provided some resource savings from his downward classification to be able to at least give him some temporary support. It's not everything that he wanted, but at least it helps meet some of the needs. So I just want to make sure we understand there's not a new position in any of this. And back on package number 1, just to add clarity, that says establishing a limited duration permanently. That limited duration is currently an overfill on a permanent position. So once again, I just want to make sure everybody knows there's not a new position, it's just more of an upgrade. Oops, that's fine.
So working foreman, this one was not recommended. What we really like to try to have is a fairgrounds foreman and a parks foreman. Gives our staff room to grow and can pull some of the responsibilities off of our maintenance manager, who has to cover a lot, and he's out in the field a lot more than probably a maintenance manager needs to be actually doing the work. So that's where that one comes from, and he would be here today, but he's been working so much, I forced him to take some of his leave before he loses it here at the end of the biennium. Let's see, so the capital project. So like I said, we have a lot of aging facilities with all of the different parking lots that we manage and things like that. If you don't take care of a parking lot, you can lose it, and the cost can end up being much more than if you were able to fund that. So these ones didn't make it through the recommendations, but they're almost all related to equipment that's either failed and we've had to surplus, or aging facilities. You'll see NA12 there. That's a water storage buffer. We've been doing a lot of work with emergency management and feel like, so the fairgrounds is the livestock evacuation center for Benton County. So if there's a fire here or a fire in neighboring counties, livestock will start to be delivered to the fairgrounds, where we will care for them. And so we have a generous neighbor that gives us access to the well water for the livestock. They can't really have the city water. So we were looking to basically keep a tank on site for emergencies. But we feel like we can do that through emergency grants in talking with our emergency services folks. So don't need that one. And NA07, the Civics Plus, we are cobbling together a whole bunch of old antiquated systems for rentals and stuff like that. And so this one, we've talked about the possibility of pulling that potentially out of TLP. And I know our finance department would love it if we got that. And it would be a lot better interface for the public as well. We've used to have to be able to drive into the fairgrounds, pick up a key to rent a shelter, go to your event, then drive back and pick it up. We got rid of that. So we're doing whatever we can to reduce the amount of driving to our office people need to do, find the answers to things that, and Civics Plus would be a big help with that. So a lot of the other ones are just aging facilities.
Right, and I might just add, this is noted in here, while these weren't approved, all of these would qualify for the capital improvement program. And so as part of our recommendations was bringing $1 million, we'll talk about that tomorrow. We are going to run an application process similar to what we did last time. Obviously, we didn't know the certainty of that program and still need to get that funding approved, but I would say all of these positions are good candidates for CIP. So, I don't want to, obviously Jesse's looking at other options, TLT and things like that, but it's 309,000. That's not unreasonable to be funding that through CIP.
Okay, so one of the bigger challenges, those master plans. So we don't just kind of arbitrarily go out and do a master plan so we can dream of what a place would look like. A lot of these are to be in coordination with our community development department so that we have these plans in place for zoning, permitting, grant writing. But also they're community led quite often. And so places like North Albany County Park, we just implemented the first phase of that master plan with a lot of infrastructure work and a new restroom. And that was really driven by the community growing around a rural county park. And now it's suddenly a city park and they expect city level services. And so we're doing our best to upgrade there. Adair is the same way. It's growing so much and the park gets incredible amounts of use. Not to mention the Fairgrounds Master Plan and the upcoming McBee Master Plan that we're working on now that this summer we'll be taking to the commissioners and the Planning Commission. So that's going to be a challenge. Jackson Fraser Boardwalk is always one of our biggest priorities. Very challenging project that we still have a funding gap. So really what we're going to be doing is looking for ways to close that funding gap so we can finally do the replacement. We've got all of our designs, we've got our land use permits, but we're very cautious about taking out that facility before we have the money to put it back. So opportunities, I would just say, interest in a lot of our sites. The community is really behind us. And so we found time and time again that they can help support us if we need additional funding or work support. Really excited about adding McBee Campground for new recreation opportunities. So that's all I have. Thank you. Any question?
Thank you very much, Jesse. Questions? Any more?
Thank you. So it sounds like we're gonna talk about capital improvement stuff tomorrow. Is that what you said, Rick?
Commissioner wise, yeah, we have capital, both the capital improvement program and also capital development in our major budgets.
Okay, perfect, because I'm, the licensing, if there's cost savings there, I'm interested in learning more about that. And same with the roof, I mean, we don't want to put that off too long, so but I'm happy to hear that we'll talk about it another time. Do you know what our current TLT percentages that we charge levy? I don't know the right words.
Oh, gosh. I would have to get back to you, I think.
Yeah, that's a good question.
What the tax rate is for the restaurants and hotels. I don't have it at the top of my head, my apologies.
I thought I read 3% somewhere, but now I don't see it.
city charges,
It's 3%, but we'll look on the website.
Okay.
the city charges 9% and we tack on 3% on top of that.
So I just, food for thought, maybe a conversation for another day. Is there an option to raise what we charge for the TLT?
Yeah, I think it's, there's statutory provisions in relation to what you can do around TLP, but absolutely great question. And I think we can certainly look into that.
Well, early on, Rick, you talked about the vacancy factor and I didn't quite understand. It looks really high
Yeah,
but I didn't quite get how we got there or if that is the right number.
yeah, so again, and again, I'll refer you guys more to this sheet as we start to go along, because this is, as I said, this calculation get a little bit long in terms of trying to account for some various adjustments and things like that, but there were, again, oversight with the transition, and there was a piece, it was supposed to be reduced, and it wasn't. And so it's still in there. Jesse and I also had some other options that we were looking at one point. Again, as he said, this was one of the toughest conversations to have because it's not like there's a lot of options. And so we were going one way and he said, no, we'll just maybe put it, maybe consider it a vacant center. And then before you know it, you're up to really 13.9%. It's too high. And it's just, I just say that that one is too high. I would, again, you'll hear me say, 3 to 5 is best practice. National averages, it shows anywhere in there. That's usually a good rate. If you start to get double digits, then I'm starting to get a little bit nervous on this one. Unless it's a specialty area. Again, attorneys are hard to hire. You're gonna have a higher vacancy in that area. Healthcare is just a lot harder to hire. So that I just want to flag that for you all. I think as we start talking about any adjustments, then that's when I would recommend you consider.
Oh, thank you.
Commissioner Shepherd?
Yeah, I have a number of questions on this one. Starting with donations. So parks are one of the few county departments people want to give money to. Nobody wants to give money to roads, but if someone comes and says, I have $100,000, what fund does that go into? How do we do that? Does that go through a friends organization? How does that work?
So some of it, they could make a donation directly to one of the Friends of groups. And so that would either be them paying for something like, say it's a donation for livestock panels. We might just ask the Friends of group to go ahead and get the panels with and just drop them off at the fairgrounds, that type of thing. We had a $20,000 donation this year to the Bazell Education Center from a gentleman that had passed away and took a lot of beautiful photos out there. So we put it in that account because that was the family's request. So we basically put it wherever they direct it to be or have them directly do the work. So if it would be something like I will pay for seeds and corn for a habitat restoration project, we would potentially have them send it directly to the folks that we have doing the planting work and that type of thing.
Okay, but is there like a special fund called the donations fund or something like that? How does that money get into
It's a line item, so it's in our revenue line item. So we have our fees for services, and then there would be grants and donations typically for us. So they get dropped in those.
Thank you. Second question, OSU Extension, on the 4-H program specifically, do they get charged to use the facilities or are they like the county rate or whatever?
No, they don't get charged. And that is based on kind of the agreement that the county initially did with the Extension Service. This kind of dates back to when there was a county agent for agriculture that I understand, but no, most of what their contribution to the fairgrounds comes in-kind volunteerism.
Okay, and then two additional questions and then a comment. So I think Commissioner Wise touched a little bit on this. But the TLT, so I saw 70%, you're saying 70% of it goes to you guys, and where's the other 30%? Is that gonna come up tomorrow?
30% goes to the general fund.
General fund. Oh, right, yeah, okay. 70% has to go to tourism, yeah, okay.
And I will just add, Commissioner, that the other 30% goes to general fund. We do have a small portion, and we didn't come up during community development, we use for compliance. In terms of, and that's something that Patriots been trying to work to stand up, to make sure that we're following up on some of the various opportunities, maybe like Airbnbs, ensuring that there is compliance with that. So that is another use for that. And just since you brought up TLT, Commissioner Shepherd, I will officially answer Commissioner Wise's question that it was enacted by the Board of Commissioners in 2019 at 3%, and you do have the discretion to amend that at your. You do have options.
Do you know what the cap is?
I don't know what the cap, but I'm sure that the person who's whispering in my ear might look and see if we have a cap on that.
Okay, well, I feel like it was 5%, but I could just be pulling that out of.
She's listening in now, so we'll see if she can comment on the answer for that.
All right. My next question, the community stage, it sounds like a great idea. I really like it. Are these scheduled or is this like an open mic thing?
No, they'll be scheduled.
Okay,
Yeah.
I had some concerns.
We're gonna sign up, weren't you?
Yeah, I can still sign up to get scheduled, but I'm just saying that some intoxicated individuals might want to take a stage if it's open mic, and I was like, I'm glad that it's planned. Okay. And the last thing I have, and I think this will be a big discussion for tomorrow, is about work crew. It has become, it seems very evident to me that the community of Benton County really does want alternatives to incarceration. And, you know, that's come up a lot of times in discussion about 140 and before and after and all that kind of stuff. And I think that it would be problematic for us to take away that option, take away work crew option. So this is something I want to make sure that tomorrow that's going to be a priority for me, is find some way. It doesn't have to be the way that we've been funding it for the last few years, but I want to make sure that this is not something that we're just gonna let go away, because like the sheriff said yesterday, we're gonna have some. Actually, I think it was the DA said we'll have some disappointed circuit judges, and because we have really limited options on where people can go and what they can do to. The word that comes to mind is atone, but you know, to serve. So I just wanted to bring that up during this conversation.
Commissioner Shepherd, if I might, so absolutely, it's on my little list here of things that you have talked a lot about. I will tell you, I think there is some options for you to consider, but I think it's also part of talking about TLT, because, you know, there's always ways, as just Jesse talked about, in terms of his fair management. That is a general funded position that could technically be shifted to the fair fund, which TLT money, as I said, there's a contingency to pick up, which frees up general fund. So again, but there's a trade-off that you're making here in terms of it. So maybe that's not, I'm just throwing that out there as a potential idea. I have some other ones as well that I can share with you tomorrow. And then to also follow up secondary to Commissioner Wise's question, there is no limits in relation to the TLT tax, and in some jurisdictions, it's in double digits.
Coastal people.
Issue.
Thank you. Yeah.
Tony,
Thank you.
Ed,
No, I'm okay.
thank you. Cassie, thank you very much.
Thank you very much.
And it's 5:54. We have a public session starting in 6 minutes. And it appears that we have one person here. Oh, okay, that's right, we need to move on to budget committee debrief.
Just really quick, one thing I've been thinking about, I had asked about, are we starting a jail fund? And it sounded like the answer was no. As I think about it, I think that is something that I really would like to see, even if we put $1 in it. And as the wise Commissioner Malone often says, the best time to plant a tree is 20 years ago. Second best time is today. That's the same with a savings account or a fund. So if we don't ever start it, we're not ever gonna get anywhere, so.
So thank you for bringing that up, Commissioner Wise, and just wrote it down on my list, but I think that's absolutely my recommendation to you would be to plant that in the capital development fund on our discussion tomorrow. You can ask for establishment of a particular cost center specifically that we can put in the fund. It would be appropriate because obviously you're collecting money for the purposes of a capital project. So, and to your point, we can put as much or as little we could, $1 in there, and then at least we can have discussions with the Board of Commissioners about opportunities that present themselves.
And can I just correct myself and say correctional facility fund? Thank you.
Ms.
Any other comments and questions or follow-up?
Mr. Chairman, I just, I know we have just, but if I might, we'll move in tomorrow, we'll have the non-departmental, we'll cover that, it'll be relatively routine. I think there'll be some good discussion there. We'll have another public hearing, and then, of course, we will move into deliberations. As I mentioned on day one, tomorrow's our last day, so we have to do it all together. I'm just gonna kind of read off to you a few notes I have here in relation to things I'm hearing. Interest and then things that I know of in terms of technical. We didn't talk about today, but there is a need for adjustment for the deflection program. It was not included in the budget. It needs to be included in the budget. So probably should talk about that, making sure that there's concurrent, there is dedicated revenue for that. And the work crew specifically noted here. Again, I have some ideas, and if there's an interest, I can come to work tonight and figure out what are the options. Vacancy factors has been a discussion. There are a few areas I would say to you that we might want to talk about. Again, we can also talk about a little bit more about that. I'm going to provide some context. There is a piece I want to make a note of around economic development. As you all know, we'll talk about this again tomorrow. Lottery money goes to pay for the Economic Development Office. That's what we use. Per our arrangements with Corvallis, we are moving away from where they will be paying for that office, which means dollars are freed up. So I just want to put that out there. Lottery money has to be used to actually, exact definition of it, but it's basically to further economic increase. That's very broad. So again, opportunity. I think at the same token, we have a trade-off with Corvallis in that they typically pay for a portion of our CRO or one of our positions. We will have to pay for that now, meaning I gotta find a resource for 40% of that salary. I think that could come from the CRO. I think you've heard a lot. I don't know where your conversations are in terms of concerns around the management adjustments. Again, if you're interested in talking about that, we can provide some additional information on what the payback or the add-backs could be. I just mentioned jail fund and Alcee Guard Station. We need to make an adjustment there. So I'm just kind of giving you the rundown. Tonight I'll be relooking at the beginning balances of the general fund to see if they're changing, because if they were to increase, that could provide us some opportunities. I'm not really optimistic, but I'm going to take a look at it one more time. There are some opportunities to talk about potential more interest earnings that could cover debt service that would free up some dollars. And then I already mentioned lottery funds and TLT. So I'm just giving you sort of a dump really quick of here's some of the things that I'm hearing from you that I'm going to need to, if there's an interest, I got to figure out how to kind of play shell games and then get all that locked in so that we can get to you for a recommendation tomorrow. So if there's something else I'm missing, please send me an email, tell me, I'll look at it tonight and see if I can figure it out. That's what I do. Thank you.
Thank you.
And with that, you brought us right up to 559.47.
Well, when a great mind comes together.
So we will open the public hearing. For anyone online or anyone in the audience that would like to address the budget committee. Sure.
Good afternoon, budget committee members. You guys have been slugging through this stuff for many, many hours. I don't envy you at all. For the record, my name is Mark Yeager. I'm a resident of Benton County. And in terms of my background with regard to budgeting, I spent 35 years preparing municipal budgets. And I served 10 years on the Corvallis School District Budget Committee. And sadly, not a lot of people are paying attention to what's happening with the budget process here in Benton County, and that's pretty typical. But I would like to express my concern that I think the path that Benton County is on is unsustainable and irresponsible. I want to highlight a couple of examples. So since June of 2019, the county has added over 160 full-time equivalent employees, a 34% increase. And since 2018, contrary to what I listened in on the first day, and Mr. Krager talked about not adding much debt to the county's portfolio. Well, since 2018, over $53 million in new debt has been issued. $9.1 million for this building that we're in, another $36 million for our share of the new courthouse. The annual debt service in the county budget has tripled to $12 million a year. And all of that debt has been encumbered without any votes of the public. In 2010, the county had 12 buildings that it owned and operated throughout the county. We now own over 18 buildings and building more. And there's no plan to deal with the existing courthouse. This our symbol of our county. And that building, I don't know what the next plan is going to be for that, but my guess is when it's ready to fall down, we'll be asking for our residents to fund a bond measure. In 2024, the county gave its management employees over $2.5 million increase in salary and benefits. And that was all under the guise of pay equity. And that process basically involved comparing Mid-Valley jobs and locations with the metro area as the basis for justifying that massive increase in management pay. I find it a little ironic that during the presentation that Mr. Krager gave the other day, yesterday, or maybe it was Tuesday, I can't remember which, there was a lot of concern about PERS costs. And yet we set the stage by doing a one-time, so all at once, increase to $2.5 million for our management employees, 114 of those. And that set the stage also for the AFSCME negotiations, because they had to say, well, look what you just gave yourself. So I think that was irresponsible. Having served in municipal government for many, many years, and having experienced many, many comp and class studies, never has anyone in any position been granted a one-time boost of $50,000 a year and there were multiple people in this class that got more than $50,000 a year increase in their salary. So shocking, and it's super sad to me that nobody's paying attention to what's happening here.
Time limit?
One final thing is, and I understand that maybe you talked about it today, But the subsidizing of the money-losing fleet management operation is just been shocking to me. First of all, using ARPA funds, $465,000 to subsidize that money-losing proposition. And then also to use Benton County taxpayer dollars to subsidize a fleet management system that provides services to counties other than Benton County. So Lynn County, Lincoln County, Marion County, Polk County. How are we using Benton County tax dollars transferred from the general fund to support a fleet management system? I guess the context for me is Benton County already is the 4th highest tax rate in the state. So besides the metro area, Washington, Clackamas, and Multnomah, we're the 4th highest tax rate. Our budget has ballooned and is continuing to balloon. And at some point, there's going to be a reckoning. So I think what's going on here is unacceptable. The public needs to know, sadly, again, no one's paying attention. And I hope that someone will start paying attention before it's too late. Thank you for your time. Happy to answer any questions.
Thank you, Mr. Hager. Is there anyone else who'd like to address the committee? No, so I will close the public hearing, and with that, we will adjourn for the evening and reconvene 1 o'clock tomorrow. Right? You want to start with?
Oh, Mr. Chairman, just to ask really quick, to the pleasure of the community, we talked about that. Commissioner White's had a good idea. Tomorrow, of course, we'll just have the one presentation. Would it be better if we moved into more of a goal setting type, situation, or would you rather keep this, this format? We can obviously do view to the public either way. But that might lend itself to be more conversational tomorrow, since we just had the one presentation. We'll have a public hearing and then we'll move into deliberations. That okay with you, just for staff's purposes, so that we can set up appropriately?
Good idea.
Mr. Wise gets the credits. We'll set it up that way.
Sounds good.
Thank you.
Thank you.